If you miss a live session, you can go back at any time to watch on demand. Go to Watch Replays and click on the session that you want to view. Have you created your own event agenda in SwapCard? Visit the Agenda and Watch Replay tabs to add sessions that interest you to your own event. You can go back to My Event to revisit any bookmarked sessions, sponsors, and items. We want to make sure that you're connecting with our industry-leading sponsors. You can interact with them by visiting the Booths and the Sponsor tab. You can also bookmark sponsors or add items to your event to view later. Sponsors have uploaded extra materials for attendees. Make sure to visit sponsors that interest you to chat with one of their team members or save documents for later. We have dedicated meeting slots set up for break times between sessions. Continue the discussion by requesting meetings from others in the SwapCard platform. Schedule a meeting with another attendee or a sponsor by visiting their page. The panelists and speakers will be addressing your questions live during the stream. During the stream, use the question tab to ask your questions early in the presentation. Go to the poll tab to answer polls that will be discussed during the live stream. If you need help navigating SwapCard, please reach out to our team by mentioning @Parks Associates in the chat box or by contacting one of our team members via our company page. We are so excited to welcome you to our Connected Health Summit 2022 series. Throughout this year, we will gather and share Parks Associates' latest research on connected health devices and solutions for consumers and bring the industry together to share their vision of our future of healthcare. After 2 years of virtual events, we're also announcing the return of our in-person events in 2022. We hope you can join us in September as we gather again for impactful sessions with insights from industry leaders and best-of-class research from Parks Associates analysts. Nothing beats the knowledge, conversations, and community that come from meeting in an in-person setting. We survey 10,000 broadband households each quarter to provide the most reliable and accurate view of the connected health market. This year, Connected Health Summit addresses opportunities for new solutions, including smart home platforms, telehealth services, voice assistants, and wearables to empower consumers, caregivers, and providers with new insight into patient health. Healthcare and technology providers have the opportunity to have an extraordinary impact on health and wellness through new applications and services in chronic care management, remote access to care, independent living, and wellness and fitness. We will discuss consumer behaviors and changing demands driven by the pandemic and new business models, IoT solutions, and deployments emerging to target these new healthcare needs. Thank you again for joining us at Connected Health Summit.
Good morning, everyone, and welcome to our first day of the Connected Health Summit of 2022. Today's session is on health in the home, the state of the market. If you haven't met me before, I am Kristen Hannock, Director of Research here at Parks Associates. I head up our coverage of health tech and connectivity, designing and authoring our custom and syndicated research, speaking at our events, and connecting with industry leaders such as yourselves. This year, we will be doing a hybrid series of events with 4 virtual sessions and 1 in-person event in September. Our next event in March looks at the subject of telehealth and remote monitoring. If you are interested in other tracks beyond the connected health space, this year we are in fact back to hosting 5 in-person executive conferences. These events are focused on all of the various areas of research we cover. Each year we support over 100 different industry events as a media or research partner. We also produce quite a bit of custom marketing content in partnership with our clients, such as white papers, webinars, and podcasts, in addition to our syndicated research coverage and custom research engagements. Before we get started, I'd like to give a special thank you to our sponsors, ADT Health, Alarm.com, EarlySense, and Rapid Response for helping to make this event possible. In terms of the agenda for today, I'll be spending the next 10 minutes or so going over some of our recent research and findings on the market. Afterwards, we'll be heading into our panel discussion on the topic of health devices and services and market expansion with a great lineup of panelists. This includes Steve Kozin, VP of Products at Alarm.com, Mark Francis, Chief Digital Health Integration Officer at Electronic Caregiver, Matt Johnson, CEO of EarlySense, and Randy Kellogg, President and CEO of Omron Healthcare. After our first panel discussion, we'll head into a fireside chat with Dr. Stephen LeBeau, President and co-founder of Valencell, and Dr. Shika Anand, Chief Medical Officer at Withings, moderated by Parks Associates' own President, Elizabeth Parks. Following the fireside chat will be our final panel of the day, looking at healthy living as a connected health use case. For that discussion, we have another great lineup of panelists, including Dr. Renee Dua, Chief Strategy Officer at Hey Renee, Andy Kaufman, GM and SVP over at WW, formerly known as Weight Watchers, Dr. John Mastro-Totaro, CEO of Movano, Laura Mitchell, CEO of Grand Care Systems, and Kian Snai, founder and CEO of Independa. So yes, over the years, we've done a lot of talking about health at home here at Parks. I should probably define it. This is a very large umbrella category, which we see as composed really of 4 major groups or pillars. 2 of the big pillars that we've talked a lot about last year are that of home healthcare and at-home wellness. Home healthcare would be your telehealth solutions, remote patient monitoring, and home visit services. At-home wellness and fitness would include your connected health devices, wearables, and at-home fitness products. There are 2 other very big categories that I'm sure are of great interest to this audience as well. And those are the senior living category, as well as the environmental quality and safety category. All of these categories have seen some major changes over the past few years, as well as accelerating demand. In fact, one of the biggest trends we at Parks are seeing is that consumers overall are much more aware of and interested in all aspects of their health than they were pre-pandemic. This applies not just to their own personal health, but also to different aspects of their homes. Helping to drive this demand is an overall market shift. The truth is that over the past few years, driven by the pandemic and resulting changes, health at home has gone mainstream. We can see this here by looking at the massive sweeping increase in adoption of telehealth services and connected health devices. Since the pandemic began, consumer adoption of telehealth, including video visits, audio visits, and direct messaging, has more than quadrupled. Approximately 2/3 of consumers have now engaged directly with remote care, in the comfort of their own homes, in some form or fashion. Adoption of connected health products that directly monitor a consumer's health status and vital signs, have reached majority adoption, finally breaking out of the plateau they had been in pre-pandemic. Wearables and smartwatches in particular lead the connected health segment, with smartwatches approaching adoption by 1/3 of US broadband households. Looking specifically at the connected health space, we see that it is beginning to follow some of the trends we noted long ago in the smart home market. For example, if a household owns at least 1 connected health device, they typically own more than 1. In fact, over half of connected health device owners own 3 or more connected health devices, with the most common combinations including a smart wearables product and a connected weight scale of some kind. Also, like in the smart home space, people are creating new in-home health device ecosystems, with many integrating their other devices into that smart wearables platform, with that platform serving as a central data hub, just like what we've seen in the smart home space with Amazon, Alexa, and Google Home. There is also a notably high overlap between telehealth usage and connected health device adoption. If somebody owns a connected health device, they are very likely to participate in telehealth visits and vice versa. Over 3 in 4 connected health device owners perform telehealth visits. compared to less than half of non-owners. Over 2/3 of telehealth users own connected health devices, compared to just 1/3 of non-users. We expect this to have a very definite impact on the healthcare market, although what exactly that will look like remains a question. Not too long ago, we had some very interesting research come out on consumer desire to integrate these connected health device ecosystems with telehealth services, having data from these devices be available for care providers and care teams to use. 1/3 of consumers consider this to be one of the key deciding factors when it comes to choosing a care provider. This rises to roughly half of parents. We certainly expect to see this type of integration, this type of data sharing become a competitive force over the next several years. Although whether this comes in the form of integrating these consumer procured devices with care platforms, or actually sending a package of devices from a care provider or insurer into the home, really remains up in the air. Honing in on the environmental quality and safety segment, we see that healthy home features, especially indoor air quality, provide an emerging value-added strategy for home and MDU builders. Indoor air quality in particular is of great interest, with builders stating that in terms of home buyer demand, advanced ventilation systems and home performance systems are ranking up in with granite countertops and luxury appliances. While this was first kicked off by concern around COVID-19 transmission, we see that heightened awareness has brought more attention to air quality overall, including not just virus filtration, but all aspects of indoor air quality. In many existing homes across the United States, ventilation is insufficient. Home building standards in many states are based on guidelines around energy usage, temperature control, and odor, not the science around healthy exposure to particulate matter, volatile organic compounds, allergens, or other potential toxins. So there has been a great deal of demand for whole home air filtration systems. This is especially the case in areas that are impacted by smoke from some of the record wildfires that we've been seeing. Last year, Taylor Morrison, one of the top 10 largest home builders in the US, introduced whole home air filtration and water filtration as standard. However, many consumers are very uncertain around the quality and effectiveness of the products and solutions they are using for filtering their air and water. To help increase consumer confidence and standardize this market, we see that certification bodies are beginning to gain prominence and importance among product makers and builders. Looking in at the senior living segment, we see that during the COVID-19 pandemic, senior adoption of technology accelerated. This represents a major opportunity for established players in the senior care space to more easily market and sell their products and services to a user base that is more familiar with and accepting of them. Looking at pre-seniors and various senior age groups, we see that adoption of smartphones, smart speakers, and even smart home products is high. Family caregivers are also buying new solutions. In 2021, the average age of the currently cared for population dropped by several years, as a majority of COVID-19 deaths were found in the 65+ population. Correspondingly, in 2021, a much higher percentage of family caregivers took action to protect their loved ones than in 2020. As many as 1 in 5 family caregivers reported buying a solution to monitor a loved one's health and safety and well-being, a 3 times increase over what we saw in 2020. New advancements in technology, such as Wi-Fi motion sensing, also promise to deliver solutions with fewer failure points and higher adherence among at-risk seniors. This enormous boom in adoption, use, familiarity, and overall interest in health technology among consumers, care providers, and others in this space has led to a corresponding boom in the investment space. According to data collected by Rock Health, we've seen investment dollars in digital health roughly double between 2019 and 2020, and double again between 2020 and 2021 as well. We've also seen a large number of mega deals taking place, with several funding rounds breaking the $500 million mark. These include Noom, a leader in clinically backed digital behavior change programs aimed at weight management, hypertension, and diabetes, as well as RO, a vertically integrated end-to-end digital care platform. Other top deals include Incitro, a company specializing in machine learning to help create medicines, as well as Hinge Health, a digital clinic for patients with musculoskeletal issues. So certainly investors and others in this space are expecting that in the long term, demand for health technology will continue to be high, with solutions targeting care and interventions in the home as a top priority. Moving into the panel discussion portion of today, it is my pleasure to introduce our great lineup of panelists here. This lineup includes, again, Steve Chazen, VP of Products at Alarm.com, Mark Francis, Chief Digital Health Integration Officer at Electronic Caregiver, Matt Johnson, CEO of EarlySense, and Randy Kellogg, President and CEO at Omron Healthcare. Steve, can you take maybe the next minute or so to tell us a little bit about yourself and what you do at Alarm.com?
Sure. Thanks, Kristen. I appreciate it. And thank you for inviting us to the summit. I'm Steve Chazen. I'm Vice President of Products for Alarm.com. I look after our partner tools and our business intelligence products, which is sort of the back office of our partners, helping them run their business, as well as our wellness and next-gen technology product lines. We have been around for 20 some years, most notably in the home security, home automation space. What brought us sort of fame in the segment was we were the first company to put a connected device into the security panel itself, so we could get signals out of the home even when the homeowner wasn't arming their system. Most people benefit from a solution when they arm it, and if they have an issue, there's a caregiver or a professional looking over their homes. With Alarm.com's technology and the signals streaming out of the home, we can build a model of what's normal or expected behavior. And so we alert on unexpected trends that the homeowner might not even be aware of. About 10 years ago, we took that same platform, increased the AI that is sitting on top of it, and now we started looking at trends for the well-being of a person at a distance. This screenshot of our wellness awareness platform gives you an idea of what we do today. We can look at those same sensors that are in the home, door window contacts, bed sensors, motion sensors, and gauge the understanding of what's normal, what's abnormal. In this case, someone's taken too many trips to the restroom. That might be a pending urinary tract infection. So this is something that we've had for many years. One of the, I think the only platform that is at scale that provides this. And we're extending this through our whole set of networks and dealers to make it even easier. What we know is that people are very busy, and we want to make it so simple that they just have the service running on the back end, making sure that the people they care about are okay. And if we detect something that doesn't seem normal, we'll tap you on the shoulder so you can engage.
Yeah, very, very interesting to hear, Stephen. Thank you so much. Mark, can you tell us maybe a little bit about yourself and what you do at Electronic Caregiver?
Sure. Thanks so much. And I'm delighted to be here. Mark Francis. I wear two hats at Electronic Caregiver. I'm our Chief Digital Health Integration Officer. Also recently started operating as our Chief Product Officer as well. In these capacities, I obviously work on our product roadmap and product development with the team there, work in terms of the strategic initiatives, and then also work on our IP portfolio as well. Electronic Caregiver, we were founded in 2009. We are a company that is a digital health technology and service company. We're in the midst right now of hiring 120 folks to staff up a clinical triage center to enable us to really go end to end from analytics and enrollment to modern technology, to health coaching and care coordination on the back end. So that gives you a sense of kind of who we are. We're US based, although last year we did set up a ECG Europe subsidiary, and we're starting to get traction in that part of the world as well. So again, thrilled to be here and look forward to a really exciting conversation.
Thanks, Mark. We're very happy to have you here as well. Matt, can you maybe tell us a little bit about yourself and what you're doing at EarlySense?
You bet. Yeah, Kristen, thanks for having us, and great to be on this panel with the rest of you gentlemen as well. So Matt Johnson, I'm the CEO of EarlySense, which is a medical device company that makes a novel sensor that, without any contact or involvement from the patient, obtains the heart rate and respiratory rate and motion data of a person so that caregivers can provide insight and care for that person without requiring very much. So we make a novel sensor, this invisible sensing technology that slides underneath a surface. So picture kind of a bed or a chair or a sofa. And we've monitored a few million patients this way. Now the standard of care in hospitals, and our latest innovations have brought us out of the four walls of the hospital and into the home so that people can monitor their health, and more importantly, their remote care teams can have insight before a person has a deterioration event. So the whole goal here is to have an ultra high, even automated compliance and adherence solution that requires no interaction from the patient, nothing to wear, nothing to do, that gives remote caregivers enough insight that they can take action with that hospital grade data before a person deteriorates.
Yeah, Thanks so much, Matt. Very, very happy and excited to hear more about kind of your solution, what you guys are up to. Randy, can you tell us maybe a little bit about yourself and what you do at Omron?
Absolutely. Thanks, Kristen, for having us on today. Great panel. I'm Randy Kellogg, CEO and President of Omron Healthcare. I think a lot of you are familiar with Omron and probably have one of our blood pressure monitors in your home or have used them in the past. We've been the #1 recommended blood pressure monitor by pharmacists and physicians for many, many years. Been in the market 40 years, trying to help people with their heart health. Recently, and when I say recently, I'll say just before the pandemic, we made a venture into the remote patient monitoring area, launched our VitalSight system, which is a remote patient monitoring platform for hypertension. As many of the other speakers talked about, we're trying to make things very easy for consumers. We're trying to get blood pressure monitors to more people, and we're trying to get that data back to the physician so the physician can actually take action on it, and he or she can recommend different things to the patient and maybe even help the patient before they get really sick. So it's really exciting to be here today to talk with you guys, and I look forward to the conversation.
Thanks, Randy. We're very happy to have you and definitely looking forward to hearing what you all think about some of these exciting new trends hitting the market. So yeah, let's dive right into our panel discussion. So I do have this, I think, burning question for all of you guys, kind of asking about how the business models for home health and health at home have really changed and evolved over the past few years. I know we've seen a lot of new partnerships emerging. We're seeing some new trends on the business to business side and on the business to consumer side as well. So Randy, you mentioned kind of the VitalSight program and some of the exciting things you're doing. Why don't you kick us off?
Sure. Business models have changed dramatically in the last 4 or 5 years. It started with the recognition by CMS that chronic disease management needed to be managed better so that they could keep people out of the hospital, keep them taken care of. And that's just accelerated through the pandemic, and it will continue to accelerate as we go forward. It's really important, as I mentioned a minute ago, to get the data back to the physician. So we need to close that gap between the physician and the patient. Bring them together, bring them closer. You shouldn't have your blood pressure high for months and months on end while you're waiting for your next appointment with the doctor. You should have your blood pressure monitored all the way through the process, and maybe within a couple weeks of starting medication or diet or some other plan, you're actually having conversations with your doctor and making a change in your blood pressure. So we've just seen more and more of that happening, and partnering with the whether they're clinicians, healthcare systems, insurers. Everybody recognizes that with 116 million patients in the United States with hypertension, 1 out of every 2 adults, there's a lot to be accomplished, and we've got a lot of things to do, and time is not on our side.
It's certainly nice to see the business models finally aligning behind the science on this. Matt, what are some of your thoughts? I know Early Sense, I think, had a bit of a pivot originally, if I'm remembering correctly. You guys started in the B2C space, and then you're now in the B2B space, kind of working in the hospital and branching out, as you said, into the home. Can you tell us a little bit about how kind of the business models have changed?
Sure. Yeah, no, happy to do so. So first focus of the company was making every hospital bed on the planet smart. I think we're well on our way toward that goal with some of our partners in the hospital space. And as we think about the home, I mean, first of all, everything Randy said is of course exactly right. This is an urgent problem. It's massive, and and chronic patients require this sort of care and attention in order for us to improve these health outcomes. And so what we're seeing more and more of is a kind of an evolution in the way that people think about risk when it comes to care in the home. So early iterations of these models were highly transactional, and we would see care in the home be engaged through a home healthcare company or a remote provider that provided visits, as well as kind of the 1.0 version of the model. And now we're thinking about that differently. So we've sort of disintermediated the model to say, how can we find and identify the highest risk for high need patients within a population? And then once we've identified those patients, how can we engage those people in a way that is appealing to them, in a way that they will embrace and stay committed to? And then finally, how can, as clinicians, how can we manage those patients longitudinally over a long period of time, with the goal of keeping their chronic condition at bay and not allowing that condition to become acute. And so often, also kind of to Randy's point, this requires hospital grade data so that we can make really confident clinical decisions without being at the bedside. And so sort of those combination of factors, I think, have contributed to the evolution of the model.
Mm-hmm. There's certainly a lot of, I think, new opportunities emerging as well. Mark, what are some of your thoughts?
Yeah, this is a great topic, and Matt and Randy were spot on in terms of how they've seen the market evolve as well. To me, it's interesting. It's almost like a little bit of a back to the future. The first time I got involved in this industry was 20 years ago with a company called Health Hero Network. Got again involved 10 years after that with Intel's digital health team, and now with Electronic Caregiver. During that evolution, you've seen technology evolve, the technology infrastructure evolve, both the providers and the patients or consumers becoming much more willing to adopt and use digital health type solutions. As just mentioned, the integrity and accuracy of data is hugely important if you want the providers to be able to take and act upon this information. And now we really are seeing a number of different business models popping up on the consumer side. Some really interesting partnerships. For example, John Hancock Insurance is partnered with Apple with the Apple Watch, and you can use the Apple Watch to monitor heartbeat, heart rate, steps, activity, and by doing so consistently over the course of time, you can get policy discounts. On the clinical side, as mentioned, COVID was really kind of a tipping point for the industry because some of the restrictions around reimbursement got tipped over, and now telehealth went from a nice to have to a must have, which now has been made permanent. So now we're moving to a future of hybrid models of care, which are going to be spanning from the clinical office all the way to the home of the consumer. And then there's going to be a series of different payment methods built around that to be able to drive adoption as well. So it's really exciting.
And I would certainly like to, I think, dive a little bit more into that kind of the reimbursement versus risk kind of angle. But first, I'd like to maybe dive a little bit into kind of the preventative versus predictive approaches that you were mentioning. So this has the science has been there for a while. I'm kind of curious about how the actual business implementation of this has changed and how the market has changed. And Steve, this is really a lot of what you guys do. So definitely good to hear what you think.
Thanks, Kristen. Yeah, the sort of playing off what Mark was just saying, we can't ignore the fact that this is not your grandfather's health market, right? This is a lot newer technologies, new kinds of approaches. Consumers are paying for health devices that in the past their doctor would have had to prescribe to them. They're gladly strapping on devices to their bodies in order to get a better picture of what's happening to them. So once you do that, where it's not too late, like you're not waiting for to become a patient, you're actually taking an active role in your health, and that has hopefully a remarkable effect on our futures. Most of the tools that people are buying now haven't existed for 5 years. You think about, even an Apple Watch or an Amazon Halo, a Whoop Band, an Oura Ring. The technology is now at a point where people can figure out what's happening to them before it becomes an issue and be predictive and preventative at the same time. So that's on one extreme. These are people using tools to stay healthy, which is amazing because the history of healthcare has been people getting sick and seeing a doctor for a fraction of an hour, and then taking that information and potentially ignoring it and coming back and seeing the physician again. Everything in this industry is about keeping people out of the hospital, but also being preventative and keeping them healthy. So that's, I think, one very interesting trend. The other one was on one of your slides, Kristen, the preamble to this, is caregivers who want to know what's happening with their loved ones. And if anything told us during COVID is being disconnected from the people we care about, that void is like unacceptable. Like we're all using virtual tools to stay connected with our workers and our friends and our colleagues and our teachers. We're going to use these tools, and we're starting to use these tools to stay connected to our loved ones. to know before there's a problem versus after one.
Yes, I think on that slide we had we highlighted the data point on people buying solutions to monitor, I think, health and well-being. There was another data point there on people buying solutions just to be able to better communicate with their loved ones and keep in contact with them. And that was also, I think, a very, very high percentage of caregivers. Certainly a lot of demand there as well. So something else that we were just talking about was kind of the models of delivering care at home and how they really compare to what's been done in the past, and a little bit about some of the challenges around there. And I think we were talking a little bit about reimbursement versus risk and value-based care. And Matt, I know that is an area that you're paying a lot of attention to.
Yeah, we do. We spend a lot of time thinking about that. Before I had the privilege of being the CEO of EarlySense, I was the CEO of one of the largest remote patient management service providers in the United States. And so we spent a lot of time kind of parsing out those two models. And we're really encouraged by the fact that there are interesting new, highly usable reimbursement codes to encourage clinicians to participate in this process. And we think that's sort of like kind of the match that lights the fuse. Reimbursement encourages people to pay attention. Paying attention creates this long tail on chronic illness. But you sort of can't have something that is chronic, that is a generational problem, and have a transactional approach to solving it. And that's what reimbursement often does. And so what we're encouraged by, in addition to the reimbursement codes, are the creative approaches to risk that many of our EarlySense customers are taking. And so EarlySense customers are typically remote patient management service providers that are looking for novel technology to put in the home that allow them to connect to the patient and understand clinical grade, kind of medical grade patient data. And so those customers of ours are engaging and embracing risk in new and different ways. That creates an incentive for them to pay attention beyond sort of an initial transaction, a post-hospitalization, et cetera. And ultimately, I think that's the answer, right? I think that the reimbursements are welcome and encouraged, and we certainly are in support and favor them. But we think looking long-term at the ownership of risk associated with these high-risk, high-need patients is critical to really fully embracing the problem. Otherwise, the time frame or the horizon that you're looking at, something that is eventually chronic, is just too short.
Mm-hmm. Yes, definitely. I remember when I was in undergrad, we were all talking about the coming of value-based care, and that was longer than I'd care to admit. So certainly these are things that have been in motion for quite some time, with just a lot of heel dragging, it seems. Randy, I'm also interested in hearing some of your thoughts. I know you're kind of on both sides of this in terms of reimbursement and kind of looking at some of the value-based care models as well.
Yeah, and what we just heard from Matt was really good, because reimbursement is a place to start. And if we can get a start, that allows us to gather data. And then when we have the data, we can turn that into how can we be more value-based? How can we take more risk? How can we be more preventive? How can we be more predictive? It's a great launching pad for everything else. People need to be able to get access to these tools, and if there's no reimbursement, there's no access. And getting that reimbursement has allowed access for thousands of people, hundreds of thousands of people with Medicare, and that will just allow us to gather the data that will make it more potentially possible, more possible to do more predictive analytics. You have to have a lot of data to predict things, and the way to get that is to gather that data in the real world, and we're able to do that now through the enablement of these programs. So it's really important that we accommodate those people as quickly as possible, get them engaged, get them taking their blood pressure or their blood glucose or their ECG or whatever the disease state there is, and get that data brought together so we can start looking at it to make strong predictions. We know with cardiovascular that hypertension is usually the first thing that happens to anybody that's going to have serious heart disease in the future. So we're all about prevention, and we're all about prediction.
Mm-hmm. Yes, and it's, I think, certainly exciting to have finally all of this data backing up everything. There'd been, I think, a lot of movements in the kind of the pilot stage of things, but actually having everyone running these programs and getting the data builds more and more of a business case to the point where very few people can ignore it anymore.
Absolutely.
So another one of the challenges that we've known historically has come with delivering care at home has been that of connectivity. So it seems that parks, we measure a lot of times the availability of internet to the home. Of course, internet to the home has grown quite a bit in the last 5 years. Past 2 years, we've seen kind of record signups, but it still does remain a challenge, especially in maybe older consumers' homes where they might not have the right kind of a Wi-Fi setup, and just the technical acumen of different people as well. So I'm interested in kind of learning what is maybe the state of the market on connectivity, and where are we looking for kind of beyond connectivity for that next low-hanging fruit. And Mark, maybe you can talk a little bit about this topic.
Yes, sure, Kristen. Happy to do so. Before jumping into that, I just want to follow up on what folks said on the earlier topic. Very much aligned with what folks are saying. The movement towards value-based care is so important. I know for us, when we work with partners, before we get started, we talk about outcomes. We want to deliver results, and to do so, it's really critically important to understand what the objectives are, to make sure the economics are aligned. And when we talk about data, what we try to do is shift the conversation from data to intelligence, because we don't want to provide data for data's sake. We want to provide actionable, curated, personal intelligence that then can be acted upon by the consumer, by the provider, and then by the extended care circle as well. When we look at the issue around connectivity, it reminds me of the old Lance Armstrong saying, "It's not about the bike." And I think that's it. We need to start thinking beyond connectivity. We've done some analysis with Intel that showed that in some senior housing communities that had become wired, that 3 months and 6 months in, you had under 20% utilization. So I think we need to think beyond connectivity and really start thinking about utility to the consumer, what applications they might engage with, and then also engagement. We can't have a bunch of siloed solutions that we expect somebody to interact with to be able to engage around their health. If you look at what CDC Director Walensky said recently, she said, most folks who had significant COVID issues had 4 or more comorbidities. So if we end up in a place where each one of those chronic conditions have a different provider, a different interface, a different dashboard, we are going to be creating a mess. So I think we need to look at this as well. While we want very, very good, competent solutions in certain areas, we really have to think about how this all comes together to be a solution, and what's going to be that enabling platform to everybody to use to be able to drive things forward.
Yeah, certainly. And I think you brought up two kind of very interesting questions here. So the first is, if you have all of these different platforms within a home, who exactly is going to be using all of them, and how are you going to learn how to use all of them? So you can have people with multiple comorbidities, of course, and each of those is going to have to be tackled. And at the same time, you have people who might already have a lot of these devices currently in their homes as their own kind of personal ecosystem. If they want to be able to share this data with the care provider, or if the care provider already has a platform, what exactly happens in that scenario? So it's going to be, I think, very interesting to see how this all shakes out. And then at the same time, we have, I think, a lot of care providers, they're not technologists. They're not prepared to drink from data from the fire hose. So it's how do you deliver that data into their current systems in a way that matches with their workflow and provides value. And that, I think, is something that a lot of very bright people are working on, but it does remain a challenge with all of the many different, very complicated systems out there on the market. Okay. So yeah, I guess any other thoughts on this topic? What are some of the kind of the big challenges you're seeing? And
I'm happy to jump in. Connectivity can either make or break a solution. If you make it too difficult for the patient to connect, they won't. So you have to work through that. And if you make your technology too complicated, they won't. We've kind of looked at the model of the least amount of work a patient has to do, the better. So we actually provide a cellular hub to work with our system. And you can put other things on that hub over time if you want to. The great thing would be if every house had its own hub and we could just connect to it. Doesn't quite exist yet, but maybe Steve will make it happen for us in the future. We need to be able to easily connect patients. So easy that with us, if you open the box, you take out the product, it already works. You don't have to do any more connectivity. And the other side of it is with the doctor. I think you mentioned getting the information to them. We send it to them where they want it, which in 90% of them is into the electronic medical record. We all go to the doctor now. They spend more time working on the EMR and looking at that than they do talking to us sometimes. They need that information to come in there, and they need it to be filtered so that they're not seeing 100 blood pressure readings or 100 glucose readings. They're seeing, hey, this patient is out of control. We need to take action.
Mm-hmm.
Yeah, Randy, since you name dropped me, I thought I'd jump in. Thank you. Yeah, on the connectivity front, absolutely agree. This has to be so easy that you just pull it out of the box and it just works. At the same time, they're going to be the whole hospital at home solutions. They're going to require and expect a system that's reliable and consistent, even has backup. So that's sort of the world we live in. We have 10,000 dealers who can go into people's homes and install what needs to be installed. We also have all the relationships with the network providers to make sure that that data is not only available, but it's secure, which is another thing that we have to talk about when you get to health data. The way we see this is there will be, just like with home automation and home security, there will be dozens, if not hundreds, of home health products. There already are many on the market, but very few comprehensive platforms that can consume that data and make sense of it. And that is really kind of the key, because the more data points you have, the more information you're sending to an overworked medical staff. They have to make sense of it. They're going to need not just the sensors, but the systems to make sense of the sensors. And that's our business.
Mm-hmm. Yeah, and certainly just being able to integrate all of these different solutions with the EMRs, EHRs in a way that makes sense is an enormous challenge on the technical side. And then just on the human side of being able to understand kind of how all these systems are set up.
Yeah, I might just jump in, Kristen, if you don't mind on this topic as well. I think that when we think about connectivity, it's in a bundle of attributes that these gentlemen have named, which you might call just sort of usability. And we think a lot about at Early Sense. We think a lot about compliance and adherence, and our goal. And I used this word earlier, and I use it purposefully, is that the Early Sense device, and there are others that are similar or take a similar approach, is sort of invisible to the person using it. And yeah, I think to Steve's point, there's a future state where there are health devices that we use and we rely on that are active, that are things that we engage with and interact with. And then there are other devices that are ambient or invisible that generate data. And there's a tremendous value in the technological platform that's required to make that happen, the connectivity platform required, and then the kind of the novel sensing platform that's required to sort of say, how can we are generating data as we speak. We all have heart rate, respiratory rate, blood pressure, pulse oximetry. This is all going on. We can measure these things, but how can we glean that information in a way that requires almost nothing from the person, so that we can understand their health without asking them for engagement? Because I think what we know, and we all know this from our own personal experiences, is only intermittently do we consider ourselves patients. Right. So we care about our health data when we care about it. And hopefully that's more often than not. But that doesn't mean that the relevance or importance goes down just because it's not top of mind for us. And so that's something we spend a lot of time thinking about.
Yeah, and certainly, I think you raised again a very interesting point, kind of talking about some of the new kind of seamless ways of collecting data and just being able to get insights, and that kind of leads us, I think, to our next topic discussion topic. So let's maybe take a few minutes to touch on some of the new technologies A few weeks ago, we got out of CES, where there's been a lot of news on new sensor tech and new innovations. What are some of the new possibilities that these technologies do open up? And Steve, maybe you can open us up on this.
Thank you, Kristen. Yeah, one of my favorite parts of my job is to get to look around corners and see the new technology that's coming down the pike. I think at this CES, it's clear that there are some trends that you can't ignore that are definitely going to be in our world in the very near future, and some already exist. I think one of them was what was just mentioned, this concept of ambient awareness, like sensors that already exist in your home in one form or another, turned into double duty to glean other sets of information from that. We're looking at Wi-Fi devices that are already being used to extend the Wi-Fi signal in your home so you have a better video call that can be used as motion sensors. We've seen radar used in phones initially, and now in a bedside hub to detect how you're sleeping. Sleep tracking has itself become its own industry. I think I've lost track of the number of ways that I can determine that I don't sleep very well. Through the device I just mentioned, things you put on your body, both rings and wearables. We've seen mattresses that do this. We've seen things that fit underneath the mattress, like EarlySense. We've seen new mattress toppers. That's apparently all the rage in the Valley. All of which are just helping the end user kind of figure out what's going on with them when they're not able to pay attention, and hopefully give them some insights as to what they should do about it. We're seeing smart toothbrushes came out at CES. I have a smart coffee mug that tells me how much caffeine I drink. And I think the session after us is going to talk about a very interesting body scan, smart scale from Withings that can kind of give you the same kind of insights into your body that you might, a couple of years ago, had to go to a doctor to get. So it's super exciting. And it goes back to the idea that we're just going to see more and more of these types of technologies that are going to be part of our daily life. And all of this is going to have to flow somewhere through systems that can make sense of it.
Yes, and I went to the Withings booth at CES, and I was able to take a look at the new body scanner. So very excited to see that that hit the market. Matt, I know you also have some thoughts on this, kind of some of the new technologies coming out and some of the new potentials there as well.
Yeah, I mean, won't surprise anybody here that we're sort of generally obsessed with things that are contact free, and so we're really interested in these ambient sensors. So we think things like temperature, radar, LiDAR, audio, I think holds some great promise. And we're interested in invisible sensors or ambient sensors for the compliance and adherence reasons that we talked about earlier, but also because we think there's a greater opportunity to integrate those sensors into your daily life, or even to have those sensors already integrated into your daily life. And so if you take your blood pressure every day with an Omron device, what else it can be gathered or gleaned from that interaction? If you brush your teeth every day and you stand on the same mat in front of your sink, then what more can we learn? And then while you ambulate around a room, what is the cadence of your walking and the speed at which you get up and sit down? What does that tell us about your health? And then generally speaking, how can we bundle this information? And one of the major technological advancements that we're all sort of talking about here is that the machine learning that it takes to extrapolate from those basic data is really kind of sophisticated. And so how can we take that information, that kind of daily life data about breathing and your heart beating and other things, and how can we use that based on that data and then what we know about you? How can we use that to extrapolate kind of how you're doing, right? Are you, especially in a high risk, high need person's life, a chronically ill senior, for instance, how can we better understand if you're trending towards a negative health event, an exacerbation in your clinical condition? Because if we can give caregivers insights around those trends a couple of days, maybe even weeks in advance, then we've got plenty of time to make sure that those chronic illnesses never become acute. And that to us, that's kind of that's the goal. That's what we wake every day thinking about.
Yes, and I think it's one of those cases where there's been, I think, a lot of very exciting research around gait analysis, around some of the other kind of analytics you mentioned. It just it hasn't quite hit the mass market yet, and I think once it does, we're going to start seeing a lot of very great societal benefits, a lot of kind of innovative new business models coming up.
Yeah, I'd love to jump in on this one as well. 100% agree with that, what everyone just said. This is a thrilling area to me, both personally and professionally. I spent the last 12 years at Amazon and at Intel working in emerging technology. So it's really exciting to seeing all this come together and being pointed into what we're doing in health and health at home. Building upon what Matt just said, taking all the different sources of data, whether it's ambient or from a direct interaction with a consumer, having the right intelligence on the back end to be able to do the data analytics, having the right algorithms, the machine learning use cases, and then the AI really then gives us information that we can act upon. We're seeing and incorporating into our products computer vision technology, because we've been doing a half a decade of research looking at how do you take data that you can get from cameras for gait analysis, for falls risk, for subtle signs of potential stroke, for signs of Parkinson's, even lack of stress or lack of sleep or stress as well. All different inputs that could be indicative of someone's changing health conditions. So I think that type of stuff is super important. The thing that we're doing is saying at the end of the day, we do see that there needs to be some engagement with the consumer. What's the best way to do that? We're doing that through the development of a virtual avatar. We call her Addison, and it's really built upon some top gaming engines to have a level of fidelity and interaction with the end user, so it becomes a delightful experience. The intention is to be able to engage folks in a place where they want to come back, have that relationship, and through that relationship and that extension of the care circle into their home through the virtual caregiver as well, to be able to drive better outcomes. Along that line, in terms of when we talk about access, we're talking about access to technology. One thing too, we have barriers of access to care. They might be because of a whole bunch of social determinants of health issues. So we're developing actually 8 different avatars, different races, different genders, different ages, speaking different languages, with different environments, to really be able to match what an end consumer might want, because we believe that'll lead to better engagement, and better engagement is going to lead to better outcomes.
Mm-hmm. Yeah, and certainly you can kind of customize your avatar in many different virtual experiences. So why not the avatar of your virtual caregiver as well?
Yeah.
Okay, very exciting. It looks like we have about 10 minutes left so far, and we do have some questions in from the audience that I'd like to make sure that we do address. And maybe one question for me if we have time. So first question, kind of in light of the ever-expanding role of connected health devices that can really help benefit the overall health of patients and consumers, how are these devices impacting and changing the role of PBMs in healthcare? If at all.
Well, I'm not sure they impact PBMs. They certainly impact clinicians. They impact nurse practitioners. They impact all the people that deliver care, because now they're getting, we've talked about getting a lot of information. Hopefully they're getting the right information to take action. So it should help them to better care for their patients, and to take the actions that need to be taken when they need to be taken, versus a long extended time before that action is taken.
Mm-hmm.
Yeah, and I suppose, I mean, of course, Randy's exactly right, and I suppose it depends on which PBM. We're gonna make a price list and a drug database aspect, and we're gonna sign up members. Like, not at all, but there's a long tail to certain drugs and certain interactions with drugs, and so to the extent to which the PBM is offering services over and above the kind of the most essential and basic PBM services, then I think there could be real opportunities for connectivity. You're a chronically ill patient, you're trying a new med, and wouldn't it be helpful if that med came with, along with that prescription, came an Omron blood pressure cuff, for instance? These are things that I think are relevant and interesting. And, I think everyone on this call, I'm quite certain, would very much welcome PBM's entry into the space. I think from our perspective, we've seen it as tepid. because the service offerings are different and a little, one or two clicks more, or one or two clicks closer to the clinical than perhaps what's been historically tried. But I think it's an interesting space to watch.
Yeah, I remember there was some interest in having smart pill bottles and other kind of compliance solutions be integrated with PBM systems. I'm not aware that that's taken off at all. So I think it was mostly interest on the side of the vendors.
I think it was more vendor driven as well. I think it's a great area for further innovation and partnership. We've seen kind of the same thing, and as we're getting better solutions that are right in that patient home to be able to do medication monitoring, medication compliance, if we could really close that circle so we can really see what's happening and have information on what that might need to be coupled with, as Matt and Randy mentioned, in terms of perhaps some monitoring, or to be able to look at adverse effects. Because if we're getting this patient-specific feedback and information on what drugs they're taking, medication mismanagement is such a major issue. Closing that circle would be fantastic.
Mm-hmm.
We don't live in this world yet, but there may be a day where the kinds of devices we've been describing that people are getting will feed into a system before you need a medication to deal with a chronic illness. And you'll be prescribed tools like this to stay in front of it versus get behind it.
Mm-hmm.
Yeah, I mean, I think in kind of there have been precedents in different spaces as well where you do have that compliance monitoring, and it is needed for reimbursement. So I can certainly see that making its way into kind of the drug space, and with PBM sort of serving as that role. So another question here.
Yeah, the first foray we've seen is the platform we put together does have APIs, so we can pull in information and partner with the Walgreens, the CVS's, the PillPack, be able to remove that barrier. We're tracking how much medication consumption is happening, if someone's coming close to needing to have a refill. So we're starting to put some of those pieces together. A lot of other folks are doing that well. I think these are steps in that direction for a more holistic approach to the patient care.
Okay, so sort of something that is maybe just beginning to get rolling.
Mm-hmm.
Okay, so we have another question in saying just because you have a CPT code doesn't necessarily mean that the insurer is going to reimburse. Then asking, how do we get more insurers to really consider new capabilities that fit under today's CPT codes to be the standards of care so that they'll actually reimburse?
You have to provide the data. So the CPT codes that we see doctors getting reimbursed or healthcare systems getting reimbursed for are basically Medicare reimbursements today. But the studies that are being done on their programs, whether we've done one with Northwestern, there's been numerous others out there, the data can be provided that this action saves dollars or improves outcomes or has some great benefit, a good outcome. Then you can go to the rest of the insurers and show them where this is a benefit, and they will adopt it. IDNs are already adopting it, but we can see, the Blue Cross Blue Shields of the world adopting it as well. But I wish it was a fast process. It's not. It's a slow process. You got to prove it. You got to work this system and help them understand it, and then you have to get them to adopt it and try it.
Mm-hmm.
Yeah, we've seen similar type things as well. This was a lot of our conversations in Q4 of last year. Folks had gone after some different CPT codes and some different technologies because they needed to, because they weren't getting patients to come in to their clinics or to the hospitals. And then it's like, okay, where are we now? Let's take a strategic assessment here. For example, if you look at chronic care management and remote patient monitoring, there are codes for that, but to actually be billed, you have to provide 20 minutes per month of health coaching or care coordination. Well, if you have 1,000 patients, that's 20,000 minutes per month. Most physicians' offices are running their practice. They don't have 20,000 minutes idle time to be able to do this. So then what we saw was then there was a lot of high interest, and then how am I going to execute this? And how am I going to do this as a business? So there's organizations, ourselves and others, that have staffed out the capability to say, if you want to do it yourself, you go ahead and do it. If you need us to play that role, we will play that role. And only folks that are really decompensating and need immediate action, those are the ones that will be pushed to you to be able to act upon. So I think all of us need to look at not just the codes itself, but what is required to actually be able to be reimbursed for that work, whether it's taking 14 vital measurements, after the emergency's gone per month for vitals monitoring, or the care coordination on that side. So I think there's business models around all this that are pretty attractive for providers. But again, this is also new for folks. There's some experimentation, there's some learning. And then from that, I think you'll start seeing things happening more in scale.
Yeah, I think that's definitely very, very interesting and certainly very helpful. So I think we have time for maybe just one more question before we have to go into our executive Q&A. This question is asking about kind of connectivity. So outside of Wi-Fi mesh extenders and paying more for ISP speed, are there any solutions that can help consumers to ensure that their internet connectivity is solid enough for their internet needs, for their medical needs? And then asking about 5G backup, or I guess it could also be 4G backup. Yeah, any thoughts on this, or is this sort of kind of this is more in the consumer space, or this would be just kind of, as you guys were saying, that hub device which would have the cellular embedded in it?
Well, cellular's a great platform, but it may not be the right platform, just one that many of us have chosen. And depending upon what data you're sending, you may be sending very small packets of data, so you don't need the greatest connectivity. You just need enough connectivity to get that data sent. So I'm not the technical guy. Maybe Steve could tell us more, but there are probably good solutions coming if they're not here already.
Yeah, in all our conversations with network service providers, they're aware of the requirement for this. And as you know, 5 years ago, this conference would not have worked.
Right.
The quality of the video and audio has gotten so much better, frankly, thanks to Netflix and other systems that put pressure on the back end to make it work. So they're aware of the requirements for this. And providers like ours have multiple ways to get the signals out. If one doesn't work, we use a different one. So there's all that built into the consideration. And we should also figure out, again, that we're all walking around with a connected device in our pockets or on our wrists. That's also a backup for the backup. So there's new ways to get that data where it needs to go. The real challenge is making sense of it before you push it into some system where too many eyes look at it and no one takes any action on it.
All right, great. I think that's unfortunately all that we have time for right now, but I'd like to thank you all so very much for joining us and participating in this very, very interesting and wonderful discussion. Very happy to have you all here.
Thank you.
Thanks, everybody.
Thank you. It's a pleasure. Thanks, everyone.
Great day.
Yes, and with that, we will head into our fireside chat with Withings and Valenza, moderated by Parks Associates owner Elizabeth Parks.
As of 2021, almost 25% of U.S. broadband households report either currently caring for an aging loved one or expecting to provide care in the next 5 years. The pandemic has exposed the vulnerability of our senior population, and an increasing number of seniors and caregivers seek solutions that keep them both safe and able to live independently. New tools like video conferencing, grocery delivery, e-commerce, telemedicine, and independent living solutions are available to serve this growing market. Retailers, service providers, and device manufacturers are expanding the market of technology solutions that support independent and safe living for seniors and caretakers. Our latest research, Health and Well at Home, Senior Assistive Technology, quantifies the impact of the COVID-19 crisis on seniors and family caregivers, assessing concerns, pain points, and the demand for technology products and services, including trending data from our past surveys. For more information on this new research, please contact our team at sales@parksassociates.com.
Welcome back. My name is Elizabeth Parks. I'm the President and Chief Marketing Officer for Parks Associates, and I'm so excited to be here for our opening sessions for the Connected Health Summit. Today, we are going to have join us Stephen LaBeouf, the founder of Valencell, and also Shikha Anand, both doctors who are joining us today to share more about the technologies that they are helping to implement and really talk about the future of healthcare and how that relates to the consumer at home. So let's go ahead and bring them in on our virtual stage. So great to see you all. So happy to be here, and I hope you had the chance to listen to the conversation in the previous session. Lots of great information that I think we will touch on and help expand for our audience. Let's go ahead, though, and start with some quick intros. So, Dr. Anand, let's go ahead and start with you and see if you can explain your role and maybe touch on some of the new announcements that your company made at CES just recently.
Yeah, great. Thanks, Elizabeth. So I'm Shikha Anand. I'm the Chief Medical Officer at Withings. And Withings is a connected device company, a connected health company. We began with a smart scale in 2009, a pioneer smart scale, and have been expanding our ecosystems of at-home health products ever since. At CES this year, we announced the launch of our newest scale, which is actually an at-home health station called BodyScan. In addition to the features associated with a scale, we've had body composition in the past, as well as BMI and weight. We've actually added a few new features because this scale has a handle. And as you pull up the handle, it's a retractable handle. You can actually also measure segmental body composition. So you can look at your arms versus your legs versus your trunk and left side versus right side, which is pretty exciting as you plan your workouts. And then you can also do a 6-lead ECG, so much closer to a medical grade ECG than what we see in watches. And then you can also do a nerve activity assessment where we stimulate the sweat glands in your feet to really better understand how well your small fiber nerves are functioning. So it's a really exciting advancement. It'll give us more data in the home and really allow us to help our users empower, better health behaviors over time.
Awesome. That's great. And I'm going to love to ask you a few more questions about some of those vital signs as we get through our conversation. But let's have Dr. LaBeouf go ahead and do a quick intro as well. Except we just need you to unmute and then you'll be all set.
Hello, my name is Dr. Stephen LaBeouf. I'm one of the founders, also the president of Valencell. And Valencell is a really interesting company in this wearable space because we're a wearable technology company. We provide wearable technology, specifically biometric sensing technology that gets incorporated in these wearable devices. Our claim to fame was we're the company that invented the first way to accurately extract heart rate information from a wearable device while people were exercising and doing incredibly motion intensive activities. And since then, as we moved on through the fitness and sports and wellness categories, we've become more actively engaged in medical oriented products, providing technology towards those ends, and even developing our first own medical product ourselves with the advent of our cuffless calibration free blood pressure technology.
So that's amazing. And I do want to touch on the fact that you have more than 100 granted patents in the field. So, really a history of innovation that you're bringing to the table. And
probably innovating right now.
More in progress. So today, we're really going to focus the conversation on some of the new technologies, some of the different data that is able to get collected, how that's getting used by the consumer, how that's getting used by physicians. Also talk a little bit about consumer expectations, as well as the timelines with getting products to market, and then the future of healthcare. What does this actually mean for the consumer at home as we move forward in a pandemic world and really rely and expect technology to be able to help us with our health and wellness, and then certainly manage any medical conditions we might have. So let's start off. And Shikha, I want to go to you here and see if we can talk a little bit about some of the current biomarkers that we are able to capture. Where were we a couple years ago to where we are now? Certainly this can relate to that announcement you all just made at CES as well.
Yeah, absolutely. So I think really there is no shortage of biomarkers we can measure in the home. In this moment, we can do a lot of what we typically do in a physical exam. I'm a primary care doctor, so we can listen to heart sounds remotely. We can look in ears and throats remotely now with camera technology, and then we can do things like measure the activity of your nerves, or look at your ECG, or these other things that were in the clinical setting. In my mind, the difficulty now is how do we help our providers really understand the data and interpret it? Because now we have even more sources of the data. It's coming from all different places. It's coming in all different formats. And there's really a data synthesis challenge that was ever present in primary care, and now is poised to get worse if we don't actually start to synthesize data for our care teams.
Absolutely, and that was certainly touched on in the previous session, talking about the integration of different devices and then be able to really end up creating meaning out of that. We are talking about serving two different groups, the physicians as well as the consumer. So Stephen, let me move over to you and see, can you give me a little perspective on the challenge there with data and meeting those two very different groups' needs, and how that, how you think that's going to end up playing out, and maybe what's that role of technology to create an integrated, unified solution that can work for both the consumer and the physicians?
So I would say that the norm is that this is very difficult for companies in our space. We've seen that it's often very difficult for our partners to gauge, or rather to juggle, this consumer side and business side. One of the general methodologies we've seen that's been very effective is in the consumer space. If you're going to make a medical wearable, then try and target that medical wearable device towards the consumer first. Prove that out, prove that use case out, prove that people dig it. People will actually use this device. And then move that into maybe a more B2B play, or maybe servicing, for example, insurers as the customers, or payers as the customers, and then potentially even clinics. And it's because that it's really important in a wearable device. And a lot of times the big problem you're solving in a wearable device is not measuring something new, but measuring in a way that is more likely to be used. And so proving that out becomes important first. Now, it also allows you to prove those points out while you're developing your strategy for how you get more integrated, say, for example, into a physician workflow. We've seen companies, for example, like Livongo, companies like LiveCore, where they took this directed consumer approach first, and then figured out how to get into the broader play to be more institutionalized, all the way to even physicians.
That's great. And, talking about that physician mindset, there is a lot of time, resources, and investment that is necessary to be able to add these types of technologies. So, Shikha, can you give us some perspective on that physician mindset? And are we in a world where this group is ready to embrace technology? Are there different perspectives depending on the type of medical practice you have? And then truly, how do you manage when a consumer comes to you with their own data, maybe it's their daily sleep data, and ask you to make sense of it in maybe a short period of time where that may not be your priority in terms of the data that you feel you need to help them with their care.
Yeah, absolutely. So agree completely with Stephen's comments about being consumer first. But I do think as companies develop, we really need to think about how the data is going to land into a physician workflow, if that's ultimately where you want it to end up. Because as we know, the care pathway is part led by the care team and part led by the patient, and so we need it in both places. So with regards to the mindset, more than ever, doctors are ready and other providers are ready to adopt technology. I think we're all really excited about it. Many of us have struggled to understand what's going on in our patients' daily lives for a long time. As an example, if I take a blood pressure in my office, it's not easy for me to figure out if that's representative of a normal blood pressure when someone's relaxed at home. Maybe they're nervous because they're at the doctor's office. Maybe there was traffic on the way in, et cetera. Many things can give you hypertension, and so it's hard to assess. So we've all been waiting for this data. And now the question is, how do we really put it into the workflows? So I think the key is organizing it into systems that people already use, that care teams already use. So as an example, we at Withings have an RPM solution, a remote patient monitoring solution, and we offer EHR integration as part of the service, because we know that it's really hard in a 15-minute visit to look in your electronic health record, do all the things you need to do, and then move into another system and do a whole nother workflow. And so the idea is that it's integrated. So that's one piece. The other is we all suffer from information overload. There are many tabs in any electronic health record. And so really helping figure out what data is most important is really important on the side of people who are managing the data. And then in terms of what we would expect from, when you go into a doctor's office with a month of sleep data, I think it's really, a collaboration between the patient and the doctor to figure out what the priorities are for the visit, and to do that at the outset of the visit. So for all of you who are patients, I encourage you to have that conversation with your doctor. As a doctor, I always want my patients' priorities to be my priorities. But sometimes if you're worried about sleep and I'm worried about your heart health and what might be happening to you in the next 30 or 60 days, we may have a slight disconnect. But once we talk about it, it's a lot easier to get to the right space. So I think there is a lot of room for patients to show their data, but the much easier way is to have it integrated into the workflows of the care teams.
Yeah, and that certainly makes sense, that integration, just creating a streamlined experience all around. And it ultimately speaks to reimbursements. And we heard on the previous panel that without reimbursements, this is just not going to happen. And so the changes that have taken place over the last 18 to 24 months have really been a catalyst. But do you have any comments? And I'll stick with you here, Dr. Anand, with this follow-up question. Can you comment on reimbursements and then that workflow pattern in getting the technology in and then tied into these reimbursement codes that some are here and some, will be coming in the future, I think, based on this new world that we're in?
So, the reimbursements are a great step forward and certainly applaud that effort. I think they also present a challenge because we are always, as doctors, in the place of having to triage in any given visit. So, if you're coming in with an acute heart issue, do I look at your weight or your sleep data for the past month, or do I address the issue at hand? So I don't think it removes that issue unless we get to a different system around how we schedule patients and manage time. And I don't think that these codes are sufficient to really change that from a systems perspective, but they are a really great step in the right direction. My hope is that with these reimbursements and with this kind of movement that's begun with this first wave of reimbursements, we'll start to see greater openness to integrating remote measurements into workflows, more seen on the EHR side, more seen on the remote patient monitoring side, so that we can get to something that really can be operated in the course of a short clinical visit.
That's great. So thanks for those comments. Dr. LaBeouf, let's go to you on, you have any comments on reimbursements? And I want to ask you a little bit more on.
Well, I tell you that it's been really critical in our particular case because it's really helped with the adoption of remote blood pressure monitoring by physicians, in which the American Heart Association has said is really important for a while now. But, physicians got to make a living. So they got to get a way to get paid, find a way to get paid. And a lot of the impetus behind this lobbying for these codes was that, hey, we've got to encourage somehow telemetric monitoring to get out there. And these codes were kind of supplemental to some other codes that have been pushed out to try and make kind of push that forward. And I tell you, I want to say was it 2018 when those codes were adopted? They couldn't have been more timely because, who would have guessed that, 2 years later, a year and a half later, they'd be really important for a lot of folks.
Yeah, absolutely. Okay, let's switch over and talk a little bit about technology and the role of connectivity in the home. So when we think about the environment in the home and broadband and Wi-Fi, and now we have these different devices everywhere, what role is technology going to play for that consumer? And then the technology that is in the devices and that ability to be integrated, interoperable with other devices, and of course to be attached into a system that has some output to it. So Dr. LaBeouf, I'd like to ask you, tell me more about artificial intelligence, any comments on 5G in the home, and where you see the smart home space and the consumer at home as it relates not only to taking care, but just the wellness portion, the everyday living that people do in their homes.
Boy, it's funny you bring this question up because we literally 2 hours ago, we had a discussion about this in our company. And it has to do with, there are many different, if you're going to have an at-home medical device, it's almost pointless to have it in the modern day without some kind of connectivity. So the question becomes, what kind do you do? And there's some standards that have been around for a while, for example, such as Bluetooth Low Energy in Bluetooth. But Bluetooth, Valencell, almost everything we do in the wearable space telemetrically is Bluetooth, but Bluetooth does kind of suck. If it's not done right, pairing's a pain. And even for people who know how to use the technology, and you think you're connected to a device, you're really connected to another one, and all these things can happen. But then there's the cellular technology, and that's great because if you've used any of these cellular scales, if you used any of these cellular connected devices, man, they can be really super seamless and you don't have to pair anything up. But when you're a product developer, getting those through, you have a regulatory pathway, but then you also have this pathway on the cellular side to get that approved through one of the carriers. That becomes another challenge you have to deal with. Now on the artificial intelligence front, the primary way we've used that at Valencell is different than a lot of other folks. And we've used it primarily to help us with our monitoring. So for example, our blood pressure technology that generates an accurate, valid, cuffless blood pressure reading from a PPG sensor, not one of those optical sensors you see on your smartwatches and this type of thing, touching the finger. The way that works is it doesn't directly measure blood flow. It doesn't directly measure blood pressure. It directly measures blood flow changes. And the AI translates that into an assessment of blood pressure and does so very accurately. And the reason it does it is because of the AI. And what you will see, I'll tell you, you definitely will see in that type of granularity from the sensor side, more of this happening for wearables because there's only so many sensors you could really fit in a wearable. And if as you try to shove more sensors into a wearable, the design constraints become tighter and tighter. So finding ways to measure more with less sensors through this layer of machine learning becomes really important.
Absolutely. And, we see so much information that is available now from the healthcare devices to the many other devices in the home, and really creates an opportunity for predictive and proactive events. And that's truly amazing, especially if it can be applied to a consumer's health.
I love being proactive. I don't want to be amateur active.
Absolutely. Got to be proactive. Love that comment. Okay, so let's talk about taking new products to market. You all, both of you have extensive experience here in what it takes to think of the product and then really get it through the whole process so that it is out there for consumers. Can you give any general comments to our audience about how to navigate that process, and anything that you think might be useful for somebody who's looking to enter the connected health space or to incorporate their solution into this particular market?
Oh, right. Well, from ValenCell's perspective, it's really interesting because we've helped so many products go to market. I want to say, I think I'm telling you right, it's over 70 products we've been in since we founded.
Wow.
And so, and even though we've been primarily a technology provider in those products, rather than owning the actual final end user product, we've had to get involved in basically every aspect of that product because the core monitoring technology is so critical to how those products work. And from a medical wearable perspective, as I was noting before, it becomes really, really important to understand your go to market. Really, really important, because it's your first launch typically needs to prove that people dig the product, that they actually will wear it, they'll use it in the right way, and that there's a demand from it from a user end perspective. There's a benefit, over say something that's been before. But then also you need to get that feedback to help you direct that towards other opportunities where you're connecting the dots now, not just between the individual and the device and what they're getting out of it, but also from the care side. Understanding your regulatory pathway is also really important. And if you haven't done it before, making sure you find the right types of consultants and people in the know on how to get that straight. Because if you don't have it straight, I've seen this before. You do a lot of development, and then you come down to introducing yourself to the FDA, and there's a lot you have to do from scratch. And there's certain statutory timelines that you can't avoid.
Great comments. Dr. Anand, you have anything to add to that?
Yeah, I would say, it's always, as you're developing a product, it's really easy to get excited about all of the possibilities of the product. And of course, that's really important for innovation. But as you really think about your regulatory and go-to-market strategy, think about the most important use case or use cases with regards to your device and shape your strategy around that, because it's different to prove from the perspective of the regulatory bodies that a product can be used in a wellness space, that a product can be used in the space of diagnosing a condition, of monitoring a condition, et cetera. So you really want to think about what is the use case, who is this product for, and what is the use case, and then build your data around that case and ensure that you do have the right consultants, but also that you have the right data with a variety of different populations to show that your products can be used across different populations. That'll be really important for the regulatory, for the go-to-market on the regulatory side.
I'll give you an example here too, right on this topic here, is blood pressure. Since ValenCell does so much in that area these days, is if you want to pursue a regulatory pathway to be substantially equivalent to a blood pressure cuff, that's one pathway. But then if you then say your use case really is to help people manage the hypertension, that could be a different pathway, or it could be additional to the 510K pathway. And so subtle things like this in a wellness device, a consumer device, I'm going to help you manage your diet and exercise. There may not be much difference in you market how your product is built by you saying that versus saying this product will help you get healthier versus this will help you manage your diet and exercise. Those maybe subtle marketing differences for a typical consumer wellness product that's not regulated, but there could be a big difference in a regulated product. Another thing I wanted to say for the folks out there who are technology providers in this space, like ValenCell, you don't always, even if there's cases where you don't have to pursue FDA approval yourself, your solution that's going in there needs to be compliant with FDA protocols. So you need to make sure you have that infrastructure in place. We had to develop that a few years back in ValenCell because we did not have that in place.
Yeah, really, really great comments, and certainly the role of the FDA, that whole process, I'm sure is incredible to navigate. So kudos to you for being able to help take so many products to market. And let's, we do have a question that's come in. that relates to the distribution of products. And we know from our data now that 25% of broadband households have a connected medical device. And as you say, a connected health device, maybe more on fitness or your steps versus, let's say, your heart rate. And I know Samsung is very big on making sure there is a clear delineation between a medical device versus a consumer grade device that it provides information. So when we look at how consumers are buying and getting these products, the question that we have from our audience is how can we get more of these devices on retail shelves? And then what are the other distribution models that we're going to see grow or expand from where they are now? And Dr. Anand, let's start with you on that one.
Okay, great. So, Withings, we sell a lot in the retail space. So, I mean, I think it's really, it's a bit of a cycle. There's more consumer demand, and with more consumer demand, there'll be more space on retail shelves for health tech products in general. And so that's where we'll see those devices come into play. So it's really about increasing awareness and demand in the population. In terms of other channels, I think we'll see a lot more of hardware as a service. So, rather than buying a blood pressure cuff, you would get a subscription to a blood pressure service. We see this in the ECG market already. We see this with some of the fitness wearables. I think we'll see more and more of that as we go on. And that's a little bit more of a direct access type of model. And then, it'll be interesting. I think there are a lot of different spaces where this can go. So we haven't yet seen a whole lot of buy your connected health device in your gym, right? There are many things that you can buy through partnerships with your gym. We see a little bit of this on the connected health side, but maybe not as much as we'll see going forward. And then potentially through your employer, through your insurance company, et cetera. I think there are a lot of channels that we could use, not just to provide as a benefit these devices, but to allow for different kind of buying channels for consumers.
Absolutely. Great comments. And a lot of this does seem to sound a lot like the smart home market, which we also cover extensively here. Dr. LeBoeuf, you have any comments you want to share?
Well, the reality, of course, is I can't say with certainty where the future is going to be on this, but what I can say is some trends, some macros that we're seeing. One of the trends that has gone increasingly so is retailers leading the way in how these devices are being presented. For example, look at Best Buy. Best Buy, they recently made an acquisition. What's the company? Is it called Current Health?
Current Health, yeah.
Current Health. And that's one of the just very more recent acquisitions they made. And if you don't need to be a weatherman to know which way the wind blows here. I mean, they seem to be proffering a solution, a subscription-based solution to like Anand was talking about before, that where you might buy into the subscription, and then maybe some devices that you get for free, in that subscription service. Of course, the folks who make those devices, they get paid for those devices, but that's one of the paradigms I see as potentially being more common. It's Best Buy. This is not the first time they've done this. I mean, arguably Best Buy was a great help in the wearable side. As a matter of fact, Withings, their first products were Best Buy really kind of helped support the placement of those, make people aware of these devices that were suddenly connected and easy to use. And I think a lot of retailers you're going to see taking more of this approach. Best Buy is kind of arguably maybe leading the way on this, but others will too.
Yeah, I think you're right on. And I mean, we look at the subscription service market across the board for consumers at home, and that hardware as a service has a great deal of value for consumers, and certainly on the business model side, that reoccurring revenue and that ability to have continuous engagement through notifications, monitoring, and information that provides safety, security, wellness, caretaking. I mean, this is the world that we're in, and that is going to continue to grow a lot. We get asked about subscription fatigue, and that is something that we take a look at across the board with all services. So far, we're not seeing a lot of subscription fatigue, but it also is dependent on some of those price points. So
it's dependent on the price points, and also one of the things that leads to subscription fatigue is a broad array of different subscriptions. So what companies like Best Buy and Amazon kind of have going for them is they can provide a single subscription that you could just add stuff to. So from the end user's perspective, I'm just adding another service to this one subscription that I have, as opposed to I've got a subscription with Amazon and I got a subscription with, Weight Watchers or whatever the case might be. And that diversity and management of all those different interfaces, maybe just really consumers typically just don't dig having to do all that. So I think that there's an advantage a lot of the players have in this space of where they, by virtue of the breadth of their platforms, kind of potentially reduce some of those opportunities for subscription fatigue.
Yeah, absolutely. And just to add to that, if you see what Amazon and Comcast, they're both come out with a television. So they're going to be introducing hardware into the market. And if you think about Amazon Prime Video, now you have the TV. So they see the hardware as a key to the services that they already provide and the money they want to capture in the future. And that, I think, will move towards this whole home vision that many of us have been looking at now for decades to, really come to fruition. So it's an exciting time to be in the industry, and that is going to have to be our last comments. I sincerely appreciate your time and joining today, and thank you so much for being here, and hope to see you on stage in person soon.
All right. Pleasure speaking with y'all.
Thanks for having us.
Great. Thank you so much. And we'll be right back for our next panel talking about use cases. So hold on just a minute and we'll be with you and our panel of executives. Thank you.
Great, welcome back. I'm Jennifer Kent, Vice President of Research at Parks Associates, and so pleased to be moderating this panel, really building off of the great conversations that have just come before. We're really taking a look at the new use cases for connected health in the home in this panel, and really what the scene looks like for 2022 as we kick off this year with our first Connected Health Summit session of 2022. So as we get started, we really have a fantastic lineup of panelists today for this afternoon panel. And I'm going to ask each of them to introduce themselves and tell you a little bit more about their organizations. So I'd love to start with Dr. Renee Dua, who's the Chief Strategy Officer at Hey Renee. Hi, Renee. Thanks for being here.
Thanks so much for having me. It's great to be here. And it's great to connect with all of you. As this beautiful slide says, I am Renee Dua. I'm the strategy officer at a company that I founded called Hey Renee. named for me in the care coordination and navigation space. And I'm also the former founder and chief medical officer of Heal, where we use software to deliver primary care in the home. Thanks again.
Great. Thanks, Renee. Thanks for being here. Next up, we have Adam Kaufman, who's the SVP of Healthcare and Diabetes with WW. Hi, Adam.
Yeah, good morning to some, afternoon to others. Real pleasure to be here. I was reflecting back. I spoke at a Parks Associates conference many years ago, so been following your work and real pleasure. And a great panel, if you allow me to compliment everyone here. I actually begged John Mastrototaro, who you'll hear from shortly, to give me a job 20 years ago. Keon and I met a couple months ago and really impressed by what they're doing. Just had a chance to meet Laura in prep for this, but really exciting what she's doing. And have been a fan of Renee's work, having been in the LA ecosystem for a long time. So really appreciate the opportunity to join you all. My role is as SVP of Healthcare at WW. That means a couple things for us. We do have a part of our business where we take the Weight Watchers subscription and package that as an employee benefit or a health plan member benefit. But increasingly, we're doing a lot of work in chronic conditions and thinking about how our wellness anchored weight loss program really fits. So would love to just share a little bit of what that means. We're really dedicated to this mission and purpose of inspiring healthy habits for everyone. And so this idea of connecting into your home, of extending into healthcare as a consumer business, or extending healthcare into consumers is a big piece of ours. And we've always lived at that nexus of science. We have, hundreds of published articles. We've run dozens of randomized controlled trials. And so for us, there isn't really a distinction between the consumer world and healthcare, although there are different ways to go to market. And we have built and maybe dispel some myths about WW. We are a digital first company. Every one of our nearly 5 million members uses our app. We have 2 million people interacting in our safe social communities every month, 4.8 score on the App Store. And it's the anchor for everything we do. And then we think about coaching and engagement in different levels. We just launched our most personalized program ever, where every individual gets a tailored guidance around what to eat, how to be active, and really supports them. So really looking forward to this conversation. We come at it from a consumer angle first, but really believe deeply in healthcare. My background briefly is in digital health and entrepreneurship, and have been in around the space a long time. So really excited to discuss with you all the changes we've seen in the last couple of years.
Wonderful. Thanks, Adam. And welcome back to Connected Health Summit. I love hearing about all those different connections that you've made with the different panelists across your career. We really believe in the value of personal networking and personal connections, and are really excited to be bringing back our in-person events this year, because we know that's such a valuable part of moving the industry forward. So great to have you back. Next up, we have Dr. John Mastrototaro, who's the CEO of Movano. John, why don't you tell us a little bit about yourself and about Movano?
Sure. Great. Well, thank you very much. It's a pleasure for me to be here as well. I've spent the entirety of my career developing medical devices, the majority of which was in the diabetes space with a company called MiniMed and then Medtronic. I had the privilege of leading the development of the first continuous glucose monitoring system that was ever cleared by the FDA back in 1999, as well as connecting it to an insulin pump and later equipping it with algorithms to automatically suspend insulin when people's blood sugars ran too low. So that was very exciting for me. Also spent many years at Medtronic looking at digital health and remote monitoring to provide ongoing support for people living with chronic conditions. I joined Movano early last year, and at Movano, we believe good health is a fundamental right, and our mission is to inspire and empower people to live healthier, happier lives using wearable tech that's simple, smart, and personalized. We just recently announced that we'll be launching our first product later this year. It's going to be a smart ring designed specifically for women who we feel have often been an afterthought when it comes to wearable technologies. We want to help people make connections between the cause and effect, and to understand how activities of daily living affect their health metrics by measuring your heart rate variability, respiration, temperature, oxygen, sleep, activity, and calories burned. We're also structuring ourselves as a medical device company out the gate. So over time, we plan to seek clearance for metrics that the FDA provides oversight for, such as heart rate, respiration, oxygen levels, as well as a few possible diagnostics we're looking into. In addition, we have a proprietary radio frequency technology we're developing for the measure of non-invasive glucose and cuffless blood pressure. Ultimately, our goal is to provide a comprehensive view of a person's health, and we want to reach customers broadly. So we plan to price it more affordably than most wearable products on the market today. And you actually heard a little bit about how to get these things out there in distribution in the prior session. So thank you. It's a pleasure for me to be here.
Great. Thank you, John. And next, we have Laura Mitchell, who's the CEO of Grand Care Systems. Hi, Laura. Good to see you, and thanks for being with us today.
Yeah, great to see you too. It's been really exciting to be on all of these Connected Health Summit panels and to listen in today. It's really gives me great encouragement listening to where the industry is going. I'm Laura Mitchell. I'm the CEO of Grand Care Systems. Grand Care has been around for 16 years, and we are a complete system that is designed around a large 17-inch touchscreen that is placed at point of care. Our clients are in the disability market and the aging market. And we kind of have a holistic approach, combining social engagement, being able to video chat, play games, entertaining things, manage your own health, as well as medication management. And then we combine a series of sensors, activity of daily living monitoring sensors, telehealth devices, and other sensors that sort of can give an all-around approach to a better life, a more connected life, and obviously alert a caregiver if something seems amiss. So our kind of goal is just healing in place, staying independent. And thanks so much. This is probably the 5th or 6th panel that I've been on with Kian, and I'm really excited to be with some of the new panelists today. So thanks for having me.
Great. Thank you, Laura. And perfect introduction to our next speaker, who is Kian Sinai. Kian is the founder and CEO of Independa. So Kian, tell us a little bit more about yourself and Independa.
Yeah, hello to everyone. Like everyone else on the panel, it's really great to be with such great folks talking with you today. I'm the founder and CEO of Independa. We are a 12-plus-year-old company focused on remote engagement, education, and care. We do that primarily through the TV. And recently, we made a major announcement with our partners at LG, where we were delivered as the healthcare platform across all consumer TVs, and that's a global agreement. So we're really excited about that. We think this medium lends itself into creating a lot of simplified as well as aggregate opportunities for what I would say is the consumerization of healthcare versus the medicalization of the consumer. We'll talk about that a little bit more, I'm sure. At Independa, what we do is we go from the hospital to the home and everything in between. And our vision is that all of us can live where we are longer, safer, more comfortably. And our passion is to help do that so we can delay or even eliminate the next episode or possibly the entire stage of care. On the hospital side, we have a patient education system that we OEM and white label, private label to partners with pillow speaker integration and hospital sensitivities and benefits. And then outside of the hospital, the interface is much more consumer centric in the sense that you get education, you get content delivery, you get access to device integrations and thresholds and alerts and all the good things that we'll be talking about today, all in one place. And so we're excited to be here. And we think just the punchline for me in terms of COVID is if there ever was a silver lining for what we're all going through, there's no question where healthcare is going, and that's in the home and to the consumer.
Fantastic. Thank you, Kian, for those opening comments and for your introduction to everybody. So again, we really want to focus on use cases among other topics today. And I'd love to start with Adam and then John on your thoughts of course, we're all as really a society and population coming through a pretty unique experience with COVID-19. We all have had some insight into connected health and the evolution of the connected health markets before that. What ways or new ways or predominant ways do you see consumers monitoring health at home now? So Adam, we'll start with you.
Yeah, thank you. So a lot of different ways, but I think I'll pick up off what Kian was saying, which is From my perspective, and as we think about it, from WW as being a big consumer subscription business, it's almost less the new ways that people are monitoring their health as the ways we've taken things that consumers have been doing and brought them into healthcare. So I think the biggest trend that we're seeing is the understanding and acceptance that consumer style services, whether those are the devices themselves, the subscriptions that attach to it, the connectivity into care, are core to healthcare. And some of those are absolutely new. The previous panel or the previous speakers talked a little bit about billing for those, and that's a big thing. But a lot of these have been around a long time. They've been adopted in pieces of the consumer environment. And so seeing them come into healthcare in ways that they weren't. I'm sure we'll talk about it, but just to give some specific examples, we're certainly seeing more interest in connected devices that monitor physical activity, which have been a big consumer category for a long time now, but within healthcare, we believe, and I think John will speak to this, that monitoring of blood glucose levels and other things will become, sort of more prominent within healthcare, but that'll actually likely come through more consumer style experiences. So I'm not sure, you may be turning back to your question, how much is specifically new. Rather, it's newer to healthcare as the domain that it was in, because these are services that people have been using for a while, and now we're finally figuring it. The last example I'd give, and I think we've all been through this, is the ability to take a picture of a home test and upload that and use that has been around for a while. It's not particularly new. It's relatively innovative, but it's been sort of barriers in healthcare that have not let us count those as lab results. But for any of us who have been unfortunate enough to have to take a home COVID test, that's not really easy to do. You can upload it, you get to a registry, and it's accepted, broadly within healthcare, but also to get your kids back to school. So I think that's an example of us taking technology that's been around a while and bringing that connection into healthcare in a very meaningful way that was hard to do before the pandemic.
Yeah, absolutely. I really love that example. Thanks. John, same question to you. I'd love to get your viewpoint.
Well, I'll touch on a couple of things, and I think Ken mentioned a little bit earlier, but I'm very excited about a couple of things in this topic. Number one, I've always been fascinated by trying to bring healthcare closer to the home. People, when they historically got sick, that end up in the ER, that's the most expensive place to treat somebody who has a condition. And ideally, the goal of health care should be to drive the interactions to the less intensive environment and ultimately get it right into the home where we can monitor people continuously and hopefully detect when they're starting to deviate out of good control and bring them back in. There's a lot of advantages to that. Number one, and I think it's mutually beneficial across the board, but certainly it's way less costly for the healthcare system in general. But secondly, it's way more convenient for the consumer and for people living with chronic conditions or people, just monitoring their overall health. Being able to do it at home and not have to make an appointment, get in a car, pay for parking, drive back, take a half day off of work, et cetera, et cetera. This makes it a lot more convenient for folks. So I think it's very exciting. We've had electronic scales and thermometers, and we've had finger stick blood glucose meters for years and years and years. And people with certain conditions like diabetes have always had to do this type of thing. But now, more recently and much more prevalently, and especially with COVID, as was mentioned, you've got cardiac recorders. You can monitor your 6-lead. You saw Withings, and we've got AliveCor and other products out there to monitor your EKG if you suffer from atrial fibrillation or other challenges, cardiac related. You can do it at home. You don't have to go and set up an appointment and get a Holter scheduled 2 weeks out. You can get one of these devices and use it in your home and send it to your doctor remotely. So it's great. And I think blood pressure monitoring, pulse oximetry, a lot of this became more prevalent during COVID, where people started to be more aware of their health and start to take more ownership of their health and start to do more of this at home. So I think this is going to continue to happen over time. And I think it's a really positive thing in general.
Absolutely. Love lots of little threads to pull on there, Dr. Mastrotaro. But one thing I really wanted to follow up on is the point that you made about, the convenience to the consumer, a new way of accessing healthcare. I mean, our Park Associates research, has continuously shown that convenience is, the number one driver for telehealth services coming into COVID-19. And then a second driver rose to the top of wanting to avoid infection and going into the facility. And even if someday COVID-19 isn't quite at the forefront of our minds, I think that both of those drivers will exist together. And you've got the kind of consumer preferences really coming to the fore in new ways. Keon, a few years back at Connected Health Summit, I remember you giving a presentation really on the consumerization of healthcare. So really interested in a few years down the road and through a very, impactful experience here, how you see that conversation has evolved.
Sure, you bet. So I was excited at the time when we talked about consumerization of healthcare, and you guys at Parks have been in the forefront of this all along. Where, a decade ago, you were talking to telco companies and alarm companies and others, energy companies about healthcare in the home, which seemed bizarre, but you were spot on. And a couple of years back, when we talked about consumerization of healthcare, the contrast is versus what? And it's really versus the medicalization of the consumer. And those two things are happening, but they're very different things. And you have the medical establishment primarily still, episodic based, cost based, and profit based, of course, coming into the home and realizing significant savings and efficiencies and all of that. And that's all good. There's nothing wrong with that. It's progress. But the wholesale change is the consumer being in the center of everything, not the patient. So it always amuses me when organizations and healthcare or health conferences talk about patient-centric. Nobody wants to be a patient. Nobody's a patient for that long anyway. And you're always like in your own home or wherever you live, doing the best you can to stay healthy. So some of us who might be more healthy than others might not appreciate that. But at the end of the day, what's happened is the blending of our goals as consumers and the trends that are happening along the lines of sleep, for instance, which didn't have any kind of medical billable code, or isolation, for instance, which didn't have one, but now everybody's talking about SDOH, social determinants of health, and others like activities and walking and steps. And the Apple Watch obviously has done a great job, and others, Fitbit and Garmin before that, in bringing that health concept. Now you have fitness on your watch, you have everything in the consumer. So all of these are part of what I think at the end of the day is happening anyway. And what the punchline for us is the COVID really accelerated off of all of that. And it accelerated, probably, we can't give enough credit to whether it's the HIPAA guidelines or FTC or CMS changing some of the guidelines to allow doctors to get paid over video chat, whether it's for mental health or teledentistry or telemedicine and other things, physical therapy. And I think that's going to drive a huge amount of opportunities into the home where people can get paid now and everything starts getting more aligned. So I'll pause there, but I think we're well on our way and just got a big boost through COVID.
Yeah, absolutely. Thanks, Keon. Now, Renee, I think that I'd love to hear a little bit from your perspective, because you have such an interesting story, even just over the past couple of years of having founded Heal and really focusing on a sort of doctor at home model and telehealth model and everything you were doing there, and then really seeing this need on care navigation and a different type of service and company that you founded with Hey Renee. So can you tell us a little bit about, in this conversation of use cases spot on what you're seeing the needs to be out there and the role of technology and connected services to really meet those needs?
Yeah, I think I've had such an interesting perspective, because the other thing that I think all of us have experienced in our own lines of work and where we are trying to help is also give ownership back to patients who we use this word consumer, but the truth is, especially as a physician who takes care of chronically ill people, giving them insight into what's going on with them and how they can control their care is a really fundamental part of bringing everything home. When I started Heal, and I actually went and delivered house calls myself, what I observed was I was able to build an intimacy with patients that didn't necessarily exist in a 15-minute visit within the four walls of a building. And for those same patients, that they were able to have a video telemedicine conversation with me, and I was able to remotely monitor their data, all done at Heal well before a pandemic. I really saw that they came to trust me more. Now in this new platform that we're building, what we're really doing is hand-to-hand combat with patients. we're saying, here are all the pieces of software you can use. We're putting them all together for you on one platform. You're going to engage and we're going to see how you're using these devices. If we give you a means to measure your blood pressure and your blood pressure keeps getting high, reading high, we're keeping an eye on you. Maybe you're not taking your medications, or maybe you're eating poorly. Maybe you're anxious and depressed and you need us to help you schedule a mental health appointment. So for us, it really is about putting control back into the hands of the patient. And because there is this underlying mistrust and distrust, and there are these social determinant of health issues where a huge portion of the population has been left out of health tech altogether. We're really seeing that that's what it comes down to, is rebuilding relationships. And the best way to do that is to meet the patient where they're at, which is at home.
Yeah, I would love to hear even more about then what this new model has done, not only for your own practice of medicine, right, but then for the people that you're serving. We talk a lot about consumer engagement with tech. Is the tech really being used? How can we, get people to engage with the app, right? You're really coming at it from a whole service kind of basis, right? So tell us a little bit about what it means for the people that you're treating.
Yeah, and actually at Hey Renee, which, my husband, who's our CEO, Nick Desai, he named the company for me after an experience with my own father, where my dad had a prolonged hospitalization, and he does have some illness. And after that hospitalization, it was, hey Renee, what do I do about remembering to take my medications or safely taking a shower? And it got me thinking, my dad has a daughter who happens to be a doctor who loves him. Everybody deserves that, right? Everybody deserves a loving caretaker who happens to have some clinical understanding. And so in this new company that, again, is just automating what I did for my father, what we are noticing in a pilot is, once again, these patients are relying on us for things I don't think doctors have time to think about, and I don't think risk-bearing entities such as hospitals or payers even recognize our issues. Remembering to take medications, with food before breakfast, you should take your insulin, checking your blood sugar 2 hours after that, getting a ride to a specialty appointment. Your vital signs show that you're anxious. Do you have anxiety altogether? Is that a diagnosis that's been missed in one of your doctor's appointments? Let's proactively get you help with your mental health. So it's a lot in this pilot that we're noticing that we are proactively engaging these patients, and then additionally building a fabric of services for them that I don't think anybody really recognizes or has time to deal with, so that they are actually getting access to care. I'll give you a great example. During the pandemic, certainly patients have not gone to get their screenings, such as mammograms and colorectal screens, because they're afraid, to go into a building and they don't want to get infected. And we're helping them find ways to get these tests done safely and on schedule and get results that they can then send back to their primary doctors. And we've seen this now quite a few times in our pilot, which I personally find fascinating, that it was just honestly holding their hands. So I think it really is this direct to patient need. How can we help? And then they're actually getting those tasks done.
Thank you for that. Laura, I'd love to bring you into this conversation as well. You mentioned Grand Care Systems being in its, I think, 16th year. So congratulations on that. But also, can you tell us a little bit about maybe how has your business evolved in terms of use cases, right? And, are people using your systems in different ways or different segments of the population? Or have you really expanded, what you're focused on at Grand Care?
Yeah, thanks. 16 years. I think none of us really thought it was going to take that long. I don't know that our investors would have been interested in that longevity. But it really did take a pandemic to push the needle forward. It took a pandemic for payers and providers to look at a marketplace and say, now we need to do this. And it was turned into from a nice to have to a need to have. And we saw our marketplace shift. We saw a lot of disability service providers come into our space. They wanted to remotely monitor and manage their clients. They were doing some remote. I'm sorry, my dog is in the background. They were doing smart homes, and a lot of folks that were moving out for the first time and living together in group homes were able to do so with the help of technology. And that was really an interesting shift for us, because when we started the company in 2005, we had the idea of aging in place, connected health in mind. When we and the idea is that sort of our clients had something that was like kind of taken away from them, right? They were independent, and then all of a sudden they retired from their job. They lost maybe that group of individuals that they were socializing with on a daily basis, and then family members or something, where it was thought of taking away their independence. Whereas in the disability market, it was exactly the opposite. For the first time, some of these folks could actually, with the use of technology, be independent. So they're very encouraged, very excited about it. A lot of the folks already had dealt with technology in some way or another. So we were just providing a way for remote caregivers to not only be able to manage these folks, but also be able to communicate with them. And a lot of the situations actually ended up where they could live independently, and they didn't have to have a living caregiver with them anymore. So that was huge, that they were able to prove that the system, our GrandCare system, along with other technology providers, were able to shift from a 1-to-6 ratio, where there was 1 caregiver to 6 residents, to 1-to-20. So that obviously was cost savings, but it was also really great for them to be able to stay independent and be able to make choices by themselves in their homes. Another shift that we saw was from payers who were dealing with medical loss ratio. They weren't having, their members weren't opting for opt-in services, elective surgeries, things like that. So we really saw a change in how we were providing our system for the members. Not only did we have to send thousands of GrandCares to folks in their 70s, 80s, and 90s and walk them through with our call center how to set it up, because nobody could go in there. So that was interesting, but it really did force us to have better user guide, better experience of being able to just set up the wizard with the sensors, prepared Bluetooth telehealth devices and whatnot. We also found that they were very engaged. We did do a pilot during that time to prove if social isolation and things like that were improved, as well as net promoter scores. And we were able to prove all of that was the case. But one thing that was very interesting was that during that time, we added a lot more engagement features, because in the background, there's the telehealth monitoring, there's activity of daily living monitoring, medication management, reminders, schedules, things like that. But we needed to provide more for these folks who were stuck in their homes. They weren't driving their cars. They weren't doing any of those things. So we added radio stations, and it was just insane how popular the radio stations were. And we kind of thought about it, and we thought, maybe it's because they're not getting in their cars and going anywhere anymore, and that was their main source of radio. And so now they were listening to radio. We had old time radio programs, car talk, podcasts, things like that, audiobooks. But we really saw a new case study of GrandCare where they were doing doctor's visits, they were logging into MyChart, they were doing the video chats. The pharmacists were able to video chat with them and check on their medications, ask if they had any questions. So it was just a really fascinating experience. And I think that it's pushing the industry in the right direction. It's sad that it took a pandemic to do that, but I think that we will see that people start to value technology as a tool for caregiving.
Yeah, thanks for sharing that. I mean, really what you're talking about also is quality of life and how that impacts our health. We know very much that quality of living and mental health, impacts our life. And the expansion on use cases in the disability market, I think is really fantastic. We actually hear a lot on the smart home side too, that just pairing a voice assistant with a door lock or a smart light to turn on your lights when you couldn't have done that before, you were reliant on somebody else. So really thinking out of the box on the radio incorporation, and what other, parts of your life, encourage you to, with a simple integration, right, can actually move the needle forward on health and well-being as well. So one use case that's I think we're likely to be talking about all year is we're seeing, of course, much more investment and experimentation and rollouts and deployments of remote patient monitoring programs and hospital at home models. Remote patient monitoring, of course, even pre-pandemic was a thing, especially in chronic care, and to a limited extent, post-acute discharge monitoring to get hospital readmission rates down. But much more attention and, again, focus on that as well. So I'd love to understand if your organizations are participating in those programs, evaluating those programs, what you think of that. And I'll start with John here, if you have some thoughts.
Sure. Well, first off, we are trying to get into that space. And one of the ways we think we need to do it with a wearable device is to make sure that it's medical grade in terms of the accuracy and reliability of the data that it provides if you're going to be using it for something related to chronic disease management, for example. I have a lot of experience in the diabetes field, so I'll talk a little bit about diabetes and remote monitoring. A lot of times folks they see their healthcare team, they're put on a new therapy, they're given some new things to do, and then they're sent home. And then often, people will remember one or two of the things and not the whole thing, and be forgetful, not be sure about things. And so I think there's a real importance to having remote monitoring opportunities with people, but it's not just about what they're home for. So from my perspective, if you've got hypertension, type 2 diabetes, other things like that, you want to measure other things at the home because you want to understand what their activity levels are like. You want to understand how well they're sleeping at night. All these things affect a person's health and are important to understand, and things, of course, like heart rate, PO2, et cetera. So having more of this data and then having the ability to have that data communicated and connected to the healthcare team, I think is really important so that they have a more complete picture of what's going on. One other topic, though, I want to cover that's kind of related to this is the healthcare system in general and payers, specifically, have always focused on treating the sick. So you wait until someone gets really ill and then you start treating them. And I think they're seeing this horrible pandemic of diabetes and hypertension, which all statistics show are going to afflict a third to a half of us all, or have both of these things over the course of our lifetimes. And today, I think 1 in every 5 healthcare dollars is spent on those two conditions alone and treating the complications and comorbidities associated with that. So I think that now people are being more open to forget about people as patients. Let's think about people as people, and let's start to do more to help people live healthier at home by monitoring them and helping them understand how their lifestyle affects their health so they can avoid ever getting some of these chronic conditions in the first place and really turn around this whole dynamic of risk for diabetes. And I think a lot of people are more, let's say, much more focused on this now because everyone's heard of the fact how people who have pre-existing conditions are at much higher risk for serious disease with COVID versus people who don't. And so I think a lot of folks are trying to figure out how to stay healthier, how to avoid these things in general. And I think overall, folks who live a healthier lifestyle are less prone to having serious things happen with whatever kind of sickness, can come their way. And so I think that there's going to be a lot more of this done in the home, a lot more to educate people about their health, about the dynamics about their health, about how exercise affects their resting heart rate and why that's a good thing to lower it. And other dynamics where you think about your activities and what it means to your health-related metrics. And I just think that this is an area that's going to continue to blossom now in the next several years as this has taken hold. And it's something that we can do as a society to help people live longer, healthier lives and avoid some of the complications that or some of the chronic conditions that are avoidable with a healthier lifestyle.
Yeah, and something that you said in the very beginning there was about how a lot of these programs, of course, also rely on the data being able to be collected, right, and kind of ways that make you clinically confident that you can, conduct a remote patient monitoring program at home or hospital at home. And I know that Movano lists a long list of vital signs that you're attempting to collect. And also engaging, I believe, in blood pressure studies and doing a lot of the work to really validate that data that you're collecting. Can you talk a little bit about what, the use of sensors and the technology and kind of the research that needs to go along with that so that we really can move forward as an industry and bringing that data that's being collected in the home from all these various form factors, into these programs?
Yeah, it's a great question. Well, first off, yeah, there's a variety of different sensors that allow you to make the measures that are being collected in devices like this. But we're treating it like a regular medical device. So we're going to go through formal clinical trials for all these things. We're already conducting clinical trials today. As we get the data that's commensurate with an FDA clearance, we will be filing with the FDA and seeking that clearance and obtaining it. So that's important to us because we want to have a mechanism by which, and Renee, can maybe comment on this as well. But if a person's at home and we're collecting heart rate and PO2 and respiration and even sleep and activity and other metrics like glucose and blood pressure long term, we want to have a mechanism to provide all that data to Renee. So if someone's going to have a virtual visit with Renee, she will have a very simple to see single page summary report that may summarize for the past, say, 30 days, what's the person's heart rate been like and respiration, PO2, glucose levels, blood pressure, and also how well they've been sleeping and what level of activity they've been undergoing, so that she has something that she can really talk to the person about in terms of, their lifestyle and how they're feeling and their general health and well-being. And I think that it's going to be very important to create those mechanisms that feed that data to the health care professional so that they have it at their fingertips when they're having those conversations and can have like I said, a much more meaningful conversation with someone about the status of their health.
Mm-hmm. Renee, go ahead. Did you want to respond to that?
I just wanted to say that's right. We doctors don't spend, a patient might see me 4 times a year. There are thousands of hours they're not with me and I don't know what's going on. And so having that information is incredibly useful. It's incredibly powerful. And I'll just say right now, additionally, because of COVID, doctors are also being asked to do too much, right? Like we are, struggling under the weight of all the responsibilities we are being given, especially when we're hired by an insurance company or a hospital, who frankly, they may not even have a clue the expectations of what we need to get done in 15 minutes. So taking that summary and boiling it down into useful trends and useful remarks is huge for us. And by the way, when we have oversight of it and we're reviewing it, we can bill for it, right? So we can actually get paid for you doing that work for us and helping us. And then we can also, help our patients. So it's very, very powerful and it's very valuable.
Thank you. So I'd like to talk a little bit more about, connected health in the opportunities to integrate with a wider connected home ecosystem, what's going on in the home. And I'm going to come to Kian here and then Adam, actually. So, when we think about the connected fitness equipment that has come into the home, connected TVs, smart home devices, I mentioned voice assistants and door locks, and the whole connected home landscape is becoming much more robust. And ever so slowly more mainstream. Kian, we know that Independa has a relationship with LG. And so we've kind of long seen the TV as a really ripe platform ripe with opportunity for lots of folks who are very familiar with that technology. The TV has been around for a very long time. And so interacting with the TV is not a difficult thing for many people. And so tell us a little bit about how you're working with LG and what that means for your users.
You bet. Well, we found out early on, we literally had the world's first tablet for older adults. We launched it a long, long time ago. And at least in our case, we found out that the universe of people who can't use a normal tablet with all the ease of use and all that goes with whether it's a Samsung or an Apple, but then who could use our tablet is very small. So when you think about, let me present it maybe slightly differently. When you think about the cost of care, we've gone from mid 70s to now over 80% cost of care being chronic conditions. And then you look at over-indexing in chronic conditions are older adults. Of course, we all know this. Then you look at the social isolation challenges of older adults, which is really an epidemic even before COVID. So you look at the cost of that, which leads to isolation and loneliness, leads to self-neglect, leads to medication neglect, then leads to all sorts of recidivism into the system with complexity and costs there, and anguish for the people involved, for the families. So you look at somebody who's lonely and isolated, guess what they're doing all day long? Watching TV. And the reason is not only because there's great programming, but also because otherwise we'd go batty. As human, as a species, we need to hear human voices. We need to have human interactions. And none of us really have gone through, many, many days, let alone weeks on end, maybe of not having human contact. And then what happens is we end up going to the ER, oftentimes for social engagement, or because nobody could even catch the smallest things around us that cost hardly anything, but would prevent some big problems. And so in that context, the TV really becomes not only a better tool, a big screen, a familiar environment, a different way to consume things, but also a preventative tool in major costs and challenges in healthcare. So we saw that early on, and we went on to the TV, and we have a device actually. So I have one here. So this device actually goes onto any TV, so you don't have to have an LG TV. And we literally have been calling it for years now the independent Any TV companion. And other TV manufacturers are also interested in doing the same thing. And I think it's the right addition to all the other things that are available. I just want to also make a couple other quick comments. As Renee was chatting, it reminds me, our chief medical officer left Kaiser Permanente to join us about 11 years ago, and he ran all of elder care programs for Kaiser. And one of the early things that he taught me, which has stayed with me forever, he said, I learned early on in my career as a doctor, he's a geriatrician, that healthcare happens when the person leaves my office. And so that's what I think we're all talking about, and all the innovation that's happening with John's work and Laura's work and what Adam's doing and Renee. It's all about what's happening outside of that doctor's office. As vital as that interaction is, there's so much more that can be done and should be done. And also in terms of not just the TV, but other devices really going into the background, like, John's Ring. It goes into the background and you wear it and then you find out about things. And you might have other choices like that are really easy, like Wi-Fi telling you whether you fell or not, or telling somebody else whether you fell or not. So you don't have to wear a PERS device, or your watch, obviously, doing a lot of that work. So it's really exciting times to get consumer sensitivities and devices really blend into healthcare from the person out into the sick care environment versus the other way around.
Yeah, absolutely. Thanks for expanding on those thoughts, Kian. And then Adam, I'm going to come to you and then to the audience for questions. So if you have questions for the panel, please submit them in the questions or the chat tab, and our team will grab them. But when I think about WW, I certainly think, obviously, you've been in the digital space, engaging your subscribers, your members, with also personalization, digital coaching services, right? Tell us a little bit more about how maybe your membership is engaging differently these days, whether or not you're seeing actually more demand for integration with other connected devices in the home, and any new use cases. Thanks. You're on mute though.
Sorry.
Now you're great.
So appreciate the question, and maybe I'll anchor it for you in a trend we're seeing. So you'll see in our tagline we talk about wellness for everyone. So if we think about well-being or wellness as sort of the consumer lens of what matters to them, it's been really interesting. You wouldn't be surprised to know we do what we call a DIP survey. Every month or at least every quarter, we're surveying our own members. We're talking to the general public. For those interested, we publish that generally, and just published a kind of a global well-being survey just at the end of last year. So we can happily share that. But one of the things we're seeing is an expanded definition of well-being. And I think John hit on it. What we think of from a healthcare lens is not always in the consumer's mindset of well-being. Like a lot of this is later stuff, but we are seeing that health in certain ways is showing up in well-being. But we're also seeing well-being expand to sleep, to mental well-being, to social connections at a consumer level in a way we haven't. And we consider ourselves, delivering well-being. So we're following those trends. We try to lead them as much as we can. And so, the answer to your question is we have extended the kinds of services. Several years ago, we invested aggressively in building out what we call our pillars, so that not only do we have incredible nutrition programming, which is sort of what we're known for, but very deep physical activity programming. A lot of that is done with partners who are developing other subscription physical activity services. We have content around sleep. We have content around mental well-being and positive psychology as well. And so the definition of what our consumers are looking for is expanded. As we've seen the expansion of health, we've begun to think about, okay, so how do we tailor our programs specifically for people with diabetes and other chronic conditions? And that's a big part of our investments going forward, so that we live in that ecosystem, because we know the consumers care about that. And you'll see we've made partnerships. We were one of the early partners with Amazon Halo. We connect to most of the physical activity monitoring because we know that larger sense of what's going on is a big part of that consumer journey. And I think that evolving an expanded sense of well-being is a big part of what we're all talking about here in balancing what healthcare is about and what consumers. One caveat I'll give, just because I think it's interesting statistics, is and not surprising, but it was interesting for us when we saw the data, is consumers, while very concerned about well-being through the pandemic, are more aware of it than ever, are also prioritizing different aspects than we may have thought. So while we've seen, obesity rates and excess weight skyrocket, we've seen isolation increase, people are prioritizing how do they go out and have a drink with somebody. And you'll hear us talk about this. They want well-being that's holistic. They want to be able to live the life they want, even while they're achieving the things they need. So from a programmatic standpoint, it's about us trying to plug into those elements more broadly than maybe we have ever done in the past.
Yeah. Now, one thing I'd love to ask you or give you a chance to respond to is in the prior fireside chat, Dr. LaBeouf from Valencell was talking about subscription fatigue, right? And the great opportunity that really the tech giants and certain people who have a lot of different devices and services to play a great role as a service provider, and maybe their subscription fatigue from getting different services from different providers. Here you are as a partner with Amazon, right, where you're providing the service and then partnering out to the device. So I just wanted to give you an opportunity to weigh in on that, since you mentioned, kind of that topic.
Yeah, it's funny. I've been around the space long enough, and I'm sure a lot of us will remember, like Microsoft Health Vault, which wasn't a subscription service. It was the idea of like you could actually connect a bunch of subscription services and make them make sense. And I think it's only been recently that the consumer experience has gotten to the point where that's actually feasible. I mean, it's trivial now if you have any of the streaming services, to say, okay, I want to buy Stars or HBO through them. So I think we've gotten to a consumer experience. I'm not sure it's quite as seamless in healthcare as we'd like. There's still questions about data. You're still signing different consents. So I would say we've got some work to do to make that experience of subscribing to well-being and healthcare services seamless. Just as simple as like different devices talk about data differently. A lot of that work's being done, Valencell and others. But from our standpoint, you're hitting exactly the business models we're thinking about. So one is, is there an opportunity for us to bring more subscription services to our members? What would that look like? How do we make that available? We've taken some steps to do that, and we have a number of partnerships. And then also the way I describe it from our business is, how do we live in these richer ecosystems, right? How do you connect to us, with Amazon being one and the consumer subscription services, but also we bring it back to healthcare. If you're an individual with diabetes or heart disease or sleep apnea or any number of chronic conditions, and you also are interested in a wellness weight loss journey, those experiences should be connected, not just the subscriptions. So we're thinking both, what do we bring into our ecosystem so it's easier for our consumers, but also how do we live in these other ecosystems so people can find us and we can be part of that journey as well.
Yeah, absolutely. Well, we only have a few minutes left, actually. So just to wrap up, I'd love to kind of back to you, Adam, and then maybe over to Keon, to hear your thoughts on really what you're looking at and prioritizing in 2022. You know, what can we really expect as we look into the year on connected health?
Yeah, so I'll be brief because I know we're running short. So a couple big themes for us. One is what the consumer wants and where they are in their own expectations, what services they're looking for is still very variable. We're not through the pandemic, and we can all track the moment we thought, the pandemic was over and then Delta came and then Delta was over and Omicron. And with each change, we see consumers, and obviously we're tracking it at mass, we track it globally, those sentiments change. So for us, it's really trying to figure out how we're there at the moments for the people who are prioritizing, right? So that's not really a connected question, but I think it impacts all of our businesses as we think about, where is the consumer at scale? Specifically within connected health, it really is how do we show up in these healthcare ecosystems, right? So if you are a person with diabetes on a set of devices, what's the experience you'd have with us? We're starting with diabetes. We publicly announced it's a big initiative for us. But if it works, you could see us thinking about how might you connect to a sleep apnea CPAP machine or other devices that we know our consumers are using that are driving their health or well-being.
Fantastic. And Kian, I think the last word to you.
I appreciate it. Well, in our case, we're focused on really bringing all sorts of various services to the consumer in an aggregate fashion. So you have telemedicine, you have telehealth in general, but you have teledentistry. We have now a Vets for Pets group that's very interested in coming on the TV. It turns out, it's really helpful to have a TV environment and have a pet be in front of your vet instead of carrying them to the veterinarian, and especially if you have a cage or you're talking about a fish and stuff. So there's lots of things that we're going to be busy on. I think overall, the idea is that if we can aggregate services, and I don't believe in the sort of subscription fatigue per se, because the alternative is much worse. Like you have to pay for things all the time and you may not use them. At least for subscriptions, if you're not using it, you stop the subscription. In our case, we believe in the model so much that we're not charging for our services. So we just, our business model depends on our partners being successful on the platform. So we have WebMD with their medical grade content, and we have others coming on. So that's a focus. I forgot to mention something on the sensor side. I'll just quickly mention. I think toilets, by the way, down the road and not too far down the road, maybe not 2022, are going to be great health devices. So talk about, preventatively catching things passively for us. So I think the Ring and the watch and things that just become part of the infrastructure are very exciting for us, TV being one of them.
Fantastic. Well, Kian, Laura, Adam, John, Renee, thank you all so much for your time today and sharing your insights and your expertise with us. Certainly a lot coming for, the amount of news that happened in 2020 and then 2021 alone, and the speed at which this market is moving is honestly fantastic to see after a long time building, right? So, but also I'm sure you guys are need a nap, maybe. a lot of work ahead of us. So we'll be catching up with you all and reading the new report out from WW. Looking forward to that. As a research firm, we'll devour it. Looking forward to reading that. So thank you all, and hope you check back with us in March, which is our next Connected Health Summit session, which is focused on telehealth and remote monitoring, health to home. Certainly, we welcome anybody who is interested in speaking in the Connected Health Summit series, virtually or in person, or sponsoring the Connected Health Summit. We really couldn't do this without our sponsors, so we really do appreciate their support. Also, of course, Parks Associates is a research firm, and we have been studying for a long time the connected health market and have a phenomenal wealth of insights on the consumer mindset, as well as what's happening in the industry in the connected health market. So please reach out to us if you're interested in seeing any of that research. So March, we're focusing on telehealth. In June, we're looking at the crossover between smart home and health, including a focus on air quality in the home, which has been a big focus, of course, with COVID being a respiratory condition over the past couple of years, as well as smart home platforms and the opportunity there. September is our traditional time for our Connected Health Summit in-person event. We're so looking forward to seeing you all in person and rekindling relationships and making new relationships in September. And then in October, we'll be focusing really on seniors and caretakers and the great work that's being done to enable them to live better and more safely and well. Right now, we have available our Connected Health research, a study focused specifically on virtual care, telehealth devices and services, both of that side, and consumer adoption, interest, preferences, and experience with those solutions. Also, a focus on seniors. We have Healthy and Well at Home, senior assistive technology, and really a focus on their use as well as their caregivers' perspectives. Also, a focus on the smartwatch specifically. We all know that the smartwatch has been incorporating all sorts of new interesting health sensors, and health is really a leading value proposition for smartwatches. So taking a special look at that device market. And this year we'll be bringing out our Connected Health State of the Market industry report, so you can look for that. Thank you very much for joining us today. Look forward to any follow-up conversations, and then talking to you again in March.